Good morning. My name is James Valentine, and welcome to the externally led patient-focused drug development meeting on adult manifestations of adrenoleukodystrophy. I'm here with my co-host, Kathleen O'Sullivan-Fortin from ALD Connect, and we're coming to you live from the Washington, D.C. metropolitan area, actually not too far from where the U.S. Food and Drug Administration's headquarters are located. To open today's meeting, it's my pleasure to introduce Kathleen, who is a founding board member of ALD Connect, who will be providing some welcoming remarks. Kathleen?
Thank you, James. Welcome, everyone, to the externally led patient-focused drug development meeting on the adult manifestations of adrenoleukodystrophy, including ALD, AMN, and cerebral ALD. The mission of ALD Connect is to provide education and vital support programs to individuals and families with ALD while striving for improved care and innovative research on our journey towards a cure. ALD is a topic close to my heart. Over 12 years ago, my son was diagnosed with ALD, and through his diagnosis, I learned that I too had ALD. Although my primary concern was, and is, my son John, I'm a mom. As time went on, I realized that there was an entire world of adult symptoms that needed attention as well. These adult patients include men with AMN and with cerebral ALD. This adult community also includes symptomatic women with ALD, not just carriers, but an often overlooked category of patients, of which I count myself a member. My involvement with ALD Connect has put me in contact with people affected by this disease every day, and I personally know several hundred individuals and families affected by the various pediatric and adult phenotypes of ALD in the U.S. and worldwide. Today's meeting is an opportunity for my fellow ALD and AMN family to shine a spotlight on our symptoms and struggles, our hopes and concerns. As you will hear and see today, many living with ALD are severely affected, and some have lost their lives to this terrible disease. Although ALD broadly affects multiple body systems, there are at present no FDA-approved treatments for any of our disease manifestations. We urgently and desperately need better treatments for people living with ALD. Today, I ask that you listen carefully to our stories and hear what my brave AMN, ALD, and cerebral ALD compatriots have to say about the daily frustrations, indignities, disappointments, and struggles that make up the life of someone unlucky enough to have ALD and AMN. We hope and expect this meeting will encourage future research and successful new product development for people living with ALD who urgently need more options. Thank you to the U.S. Food and Drug Administration for giving us permission to hold this meeting and for attending. We are incredibly grateful for this opportunity to share our experiences with you. Thank you also to our generous supporters who financially sponsored this meeting, including Autobahn Therapeutics, Minarex Therapeutics, and Swan Bio. We are really pleased to have so many stakeholders in attendance, including representatives from advocacy and professional organizations, drug companies, federal agencies, and universities from across the world. And to my fellow patients with ALD and our loved ones and our caregivers from across the globe who have taken time to be here today, this meeting is for us, and this meeting is about us. We invite you to call and write in during the program and ask that you participate in the remote polling as well. We want to hear as many different stories and perspectives as possible. Understand that we will do our best to get to all of our comments. Please only use your first name and no other identifying information should be shared. And I will note that those comments that we cannot get to will be just as important because they will be collected and published in the Voice of the Patient report. Let's get started. To begin today's meeting, I am thrilled to introduce Dr. Wilson Bryan. Dr. Bryan is the director of the Office of Tissues and Advanced Therapies in the Center for Biologics Evaluation and Research, CBER, at the FDA. Dr. Bryan will provide some opening comments from the FDA perspective. Dr. Bryan, over to you.
Good morning. And thank you for that kind introduction. I work in the Office of Tissues and Advanced Therapies, or OTAT, in the Center for Biologics Evaluation and Research, or CBER, at the Food and Drug Administration. I am here today, along with colleagues from CBER, from the FDA's Center for Drug Evaluation and Research, and the Center for Devices in Radiological Health. I appreciate the opportunity to say a few words on behalf of the FDA. This year is the 40th anniversary of my graduation from medical school in Chicago. I subsequently trained as a neurologist and specialized in neuromuscular disorders. Throughout the 1990s, I worked with a group of neuromuscular specialists in Dallas, Texas. During those years, I remember seeing a few patients with adrenomyeloneuropathy. Before coming to our clinic, these patients had often seen multiple doctors, including several neurologists, and still did not have a diagnosis after many years, sometimes decades, of symptoms. This was in the days before genetic sequencing made it easier to make diagnoses. And my colleagues and I were able to make the diagnosis of adrenomyeloneuropathy only because we listened carefully when the patients told us about their symptoms. I stopped seeing patients a little over 10 years ago, and I've not seen a patient with adrenoleukodystrophy in over 20 years. Therefore, I'm here today for a refresher course. And I'm hoping that things have changed. I'm hoping that what I hear today from Dr. Eichler and from the patients is that the diagnosis is usually made early in the disease so that patients no longer struggle for so long with the uncertainty of their diagnosis. But getting a diagnosis is not enough. I remember back in the 1990s that we had so little to offer our patients with adrenomyeloneuropathy. Today's meeting will serve to advance the development of new and better treatments for ALD. These new treatments may be innovative devices and new life-changing drugs or gene therapies. Particularly, what we learn at this meeting will help the FDA to think about how clinical trials should be designed. What endpoints are meaningful to patients? And how to balance benefits and risks of a new product. Also, this meeting's Voice of the Patient report will become a reference document for our review staff as we consider new applications. Therefore, I would like to thank ALD Connect for organizing this meeting. I would also like to thank Autobahn Therapeutics, Minorix Therapeutics, and Swan Bio for sponsoring this patient-focused drug development meeting. And more importantly, for the work that they are doing to develop new treatments for ALD. Drug development is not easy. It requires many years of scientific inquiry and a commitment of substantial resources in the effort to make life better for patients. All of us owe you a debt for that commitment and effort. I also want to thank you, the patients and caregivers, whom we will hear from today. When I was a practicing physician, I knew that making an accurate diagnosis depends on listening to the patient. Working at the FDA, We know that good drug development also depends on listening to patients. Adrenoleukodystrophy is a diverse disease with a variety of clinical manifestations. No two patients are exactly alike. So while it is important that we hear the voice of the ALD community, it is even more critical that we hear the many individual voices of the members of this community, discussing the full range of challenges that you are facing. Those of us at the FDA need for each of you to continue to speak up, and we will continue to listen. Back to you at the studio.
Thank you, Dr. Bryan. And now I would like to introduce my doctor and my friend, Dr. Florian Eichler, who will be presenting a clinical overview of ALD to help create a scientific foundation for the rest of today's meeting. Dr. Eichler is one of my fellow co-founders of ALD Connect and a true champion of AMN and ALD patients everywhere. Dr. Eichler is an associate professor of neurology at Massachusetts General Hospital, MGH, and Harvard Medical School. Following his training at Johns Hopkins with the late Dr. Hugo Moser and residency in pediatric neurology at MGH, he became the director of the leukodystrophy service at MGH that cares for patients with an increasing variety of neurogenetic conditions. We are truly fortunate that Dr. Eichler is here to share an overview of the adult manifestations of ALD from a clinical perspective. Dr. Eichler, take it away.
Thanks for that kind introduction. I'm delighted to be here at this patient-focused drug development session, and I think it's wonderful that FDA has created a forum to present on this important disease, X-linked adrenoleukodystrophy. The core value here is the patient voice and the patient perspective on their experience with disease. And my role here is that of setting the stage by providing a background on the disease and its clinical features. Briefly, some relevant disclosures. I'm co-PI of an ex vivo lentiviral gene therapy trial in cerebral ALD, and also site PI of a liraglutide trial and consultant to multiple companies, and founder of Swan Biotherapeutics. Here's my outline. I'll be speaking to X-linked adrenoleukodystrophy, explaining how this disease comes about, what the pathophysiology is, and how we understand the various manifestations and clinical features in adulthood, and how we can also treat this disease currently and where the unmet need and opportunities lie, but importantly also what the challenges are for drug development. So what is X-linked adrenoleukodystrophy? This is a single gene disorder caused by mutations in the gene ABCD1 that encodes a peroxisomal half transporter. This results in accumulation of very long chain fatty acids in all tissues, as illustrated here in the graphic below. Importantly, this is not a lipid storage disorder, as you might know from lysosomal disorders. There's no enzymatic defect or buildup of lipids in the cells that cause a dysfunction, and hence that you cannot also use very long chain fatty acids or enzymatic activity to describe severity or disease progression. The clinical spectrum of this disease is complicated, and it is really connected to various distinct manifestations and pathophysiologies that I will describe in more detail. It has long been known to be a disorder of childhood, and the highest incidence of and progressive inflammatory demyelination occurs between the ages of 4 and 10, what has been less well understood is that it affects a lot of adults in forms beyond cerebral demyelination alone. So in adulthood, you're still at risk for this inflammatory demyelination, as shown here in the red line in the bottom left. But the predominant disorder that takes over in adulthood is that of a adrenomyeloneuropathy, a chronic axonopathy affecting the spinal cord. Important to note that adrenal insufficiency, while often diagnosed in childhood, continues to be diagnosed in adults as well. And ALD in women is something that we are becoming increasingly aware of and is becoming a huge part of our specialty clinics dedicated to ALD. So in short, this is not a disorder of childhood alone, but really a disorder that afflicts more and more adults and warrants better management and treatment and drug development. What is the epidemiology of ALD? While ALD is the most common paroxysomal disorder, it is still a rare disease with less than 10,000 people affected in the US. Based on recent newborn screening estimates, the minimum frequency is thought to be 1 in 14,700 people. Note that more than half of the states in the United States are screening now for adrenoleukodystrophy. This is leading not only to many more newborns being diagnosed in a pre-symptomatic state, but also multiple relatives of these newborns and adults coming to attention that had for years and decades been misdiagnosed. Hence, we are still trying to understand true estimates of prevalence in the United States. What does the pathophysiology look like in men? I want to distinguish two main pathologies. One is that of the myeloneuropathy that affects the longest tracts in the spinal cord. This is the default pathway of this gene dysfunction. If you are old enough, you will be affected by some degree of myeloneuropathy. It affects the cortical spinal tracts that run down from the cortex and brain into the spinal cord, passing on motor signal to muscles and nerves. And on the other hand, sensory information coming up through the dorsal columns, as shown here in the center, as sensory information is bringing information on proprioception, that's joint position sense, and pain and balance to the brain, very important long tract functions. In contrast to this myeloneuropathy, brain demyelination still affects men at a lower percentage than known to affect boys, but still causes a more rapid, progressive inflammatory demyelination that many men succumb to. And this picture here on the right shows the zonal pathology of brain demyelination with all the inflammatory cells that are infiltrating the brain, similar to what you might see in multiple sclerosis or other inflammatory disorders of the brain. And we have a very good surrogate marker of this inflammatory demyelination in the form of brain MRI. Pathophysiology in women is akin to that in men, in the sense that women are also affected by a myeloneuropathy, again, affecting the cortical spinal tract and dorsal column. Similar to men, these long tracts that are affected spare the lower motor neuron. So this is unlike amyotrophic lateral sclerosis. But beyond the aspects that affect men, there's likely also pathology that is distinct and different And we know that women have a higher incidence of small fiber neuropathy and pain, but they also suffer more frequent movement disorders such as restless leg syndrome and tremors and other movement disorders. So there's still a lot that is being learned here, but it is safe to say that women are similarly affected over a lifetime. So what are the clinical features in men? AMN causes progressive stiffness and weakness of the legs. Balance problems and falls are common. Bowel and bladder are affected with abnormal sphincter control, neurogenic bladder, sexual dysfunction. Numbness and pain results from the polyneuropathy. And cerebral ALD, as I described before, in the form of the inflammatory brain demyelination, causes a whole host of different neurologic symptoms ranging from cognitive decline and behavioral abnormalities to impaired vision and auditory discrimination, as well as seizures. But even in the absence of brain disease, the spinal cord disease causes a huge amount of disease burden and affects gait and balance and other domains. And shown here, gait disturbances and sensory disturbances usually come on in the late 20s, early 30s, together with bowel and bladder symptoms that often come on a little later. In women, clinical features are similar to AMN. They have an AMN-like phenotype with peripheral neuropathy and myelopathy symptoms occurring. They also have gait and balance difficulties with leg weakness and spasticity. But they tend to have more fecal incontinence and numbness and pain than men experience. And importantly, their movement disorder, the movement disorders that they exhibit have so far not been recognized in men. And these occur, importantly, in the absence of brain demyelination. So women have a very prominent myelopathy, although a little later in onset. They do not suffer from adrenal insufficiency, and they also do not experience brain demyelination. So what is the clinical course in women? The onset of symptoms in women was first described by a group in Amsterdam and Brain in 2014. And you can see that over the course of the lifetime of a woman, symptoms increase. And when we looked at this in our cohort in MGH, we also found that the occurrence of myelopathy symptoms was similar to men, but it occurred about 10 to 15 years later than what is seen in men. So a huge amount of disease burden over the course of a lifetime. Most women affected by ALD experience symptoms in their lifetime. Beyond the many symptoms that I've told you about, there is a significant impact on activities of daily living with many downstream complications causing disability, death, depression, fatigue, affecting psychosocial aspects, causing substance abuse, economic consequences, hospitalizations, and surgeries. And you will hear about all this more eloquently from the patients themselves. So how do we treat these diseases? Sadly, we do not have effective symptomatic treatments that go very far. We use gait and balance. We address gait and balance with physical therapy and physiatry colleagues. We treat spasticity with muscle relaxers such as baclofen, use antidepressants to treat depression. Many patients are in counseling. Adrenal replacement is important to address fatigue and possible adrenal crises. Dysphagia can be prevented, and aspirations by proper counseling and understanding food choices and using appropriate services. There are no disease-altering treatments available right now. Bone marrow transplantation in adult cerebral ALD remains challenging. While it is effective in the early stages in boys, it is fraught with complications in adults. However, there are numerous opportunities around biological pathways and new genetic therapies that have gotten the patients and communities excited. And this has to do with really a well understood pathway from ABCD1 mutation to metabolic disease affecting the axons and the nervous system compartments. So what are the challenges for drug development? First and foremost, individual variability in the disease course is important, and I hope I've convinced you that the pathophysiology and the subsequent phenotype matters. Progressive disease may be best treated in the early but poorly recognized stage of disease. The various distinct manifestations and phenotypes can overlap, and how to best measure disease and these different pathophysiologies. That is the conundrum that we currently face. In conclusion, ALD has phenotypes with distinct pathophysiology that can occur separately, but can also overlap. Treating in the early stages is tantamount and probably most effective. Disease burden is high, even in the absence of brain disease. Clinical manifestations and disease course are determined by the compartments affected and poorly treated with currently available medications. So while we see patients regularly and address with the help of rehabilitation, pain and spasticity, these treatments provide limited relief and do not halt the progression. What we really need is to measure the clinical manifestations, associated biomarkers, and the impact on activities of daily living. This will make a difference to drug development. And we are excited that now medications and treatment platforms are available that can target the many steps in the pathophysiology that we know about. Thank you, and back to the studio.
Thank you so much, Dr. Eichler. I'd now like to welcome our meeting moderator for today, James Valentine, who we've gotten to know over the past several months as he's helped us plan this meeting. James has worked the last 14 years as a champion for the patient voice. James previously worked at the FDA, where he was a patient liaison, helping to incorporate the patient voice into medical product review. There, he helped to develop and launch the Patient-Focused Drug Development Initiative. In private practice, James has worked with many patient organizations to ensure their community's voices were heard by decision makers. Relevant to today's meeting, James has been involved in helping plan and moderating 3/4 of the over 55 externally led PFDD meetings. So we are in good hands with James.
Well, thank you, Kathleen, and it's a pleasure to be here and have the opportunity to help facilitate today's meeting. So now that we've heard a clinical overview from a disease expert, we turn to the core of today's meeting, which is to hear from you, people living with the adult manifestations of ALD and their direct caregivers and family members. As we've heard, patient-focused drug development is a more systematic way of gathering patient perspectives and input on their condition and on available treatments. As you heard earlier from FDA's Dr. Bryan, your input can help inform the agency's understanding of ALD to inform drug development and review. While FDA has held many of its own patient-focused drug development, or PFDD, meetings, today marks the 60th of the externally led patient-focused drug development meetings. With over 7,000 known rare conditions, this is truly a unique and important opportunity for this community. Today's meeting is interactive, so let me tell you a bit about what we'll be asking of you and how today's meeting will be organized. First, in our morning session, we'll be exploring the patient and caregiver experience of living with ALD and its impacts on your daily life. We'll then build on that, and in our second session in the afternoon, we'll bring everyone back together to explore the various approaches to treatment, including different experiences you may have in clinical trials. We'll also be asking for your preferences around future treatments. So what will these two different discussions look like? Well, today we'll really be using three different ways or methods of hearing from you. First, to kick off each of those two topics, we'll be hearing from panels that are made up of both patients and caregivers of individuals with adult manifestations of ALD. These statements will, these panels will help set a good foundation for our broader discussion by representing a range of different experiences with ALD, both in terms of the condition and treatment approaches. But we know that a handful of patients on a panel cannot fully represent that patient experience. And so following that, those panel discussions, we will be then moving into a facilitated audience discussion with the rest of you. All of you are patients and caregivers who are tuned in today. Again, this longer session is intended to build on that panel and what we've heard. I'll be asking questions and inviting you to provide comments. You'll be able to provide comments in one of two ways. We want you to dial in by phone, or you can also submit written comments. You'll also notice that we have invited a handful of patients and caregivers to participate live by Zoom, so they'll be participating in that discussion as well. Third and finally, we'll be broadening our discussion periodically through the use of polling questions. Questions for our patients and our caregivers. You can use a browser on your phone or open a new browser tab on your computer to follow along with these questions throughout. And we're going to get to our first set of questions here in a few moments. But before we do that, we want to give you a chance to get into that system now, and you'll be able to stay on that web page throughout the entire day. So I'm going to ask that you go ahead at this point, pull out your phone, open up a browser, open up a new tab on the web browser you're using on your computer, whichever you prefer, and go to www.pollev.com/ALD-PFDD. Again, feel free to go there now, pollev.com/ALD-PFDD, and we'll be getting to polling questions very soon. We'll be using these polling questions to get a sense of the experiences of our audience, as well as to help aid in the discussion. I want to also mention that there will be an opportunity following today's meeting to have written comments submitted, and this will be open for 30 days after the meeting. We appreciate that we may not be able to get to everybody that calls in on the phones. We also know that you may leave the meeting today and have an idea, something that you didn't think of throughout the course of today's meeting. We'd love for you to come back and submit that written comment. Or if you're tuned into this meeting on demand after the live meeting, if we're still within those 30 days following the live meeting, we would like to hear from you as well through those written comments. All of today's input, as well as all of this written input, will be summarized in what's called a Voice of the Patient report, which is a summary report of today's proceedings, and that will be provided to the FDA, as well as be made publicly available on the ALD Connect website, so it can be available to researchers and drug developers. So one last thing before we get into it and start hearing from you, I want to lay out a few ground rules. First, we encourage individuals with adult manifestations of ALD and their caregivers and family members to contribute to this dialogue. You can do that again by polling, calling in by phone, and submitting written comments. This discussion is limited to patients, family members, and other direct caregivers only. Our other stakeholders from the FDA, drug developers, and clinicians, we are glad you're here, and we welcome you to listen and learn throughout today's session. We also know that the views expressed today are inherently personal, and the discussion may get emotional at times. So it's important, and respect for one another is paramount. And to that end, we do ask that you be focused and concise in your comments so that we can hear as many voices as possible. So without further ado, let's get into our first set of polling questions. These questions are designed to give us a sense of our audience today. So you should have already gone to pollev.com/PFDD. If you already have that open, you'll see our first question. If you haven't gone there yet, go ahead and open that tab, open a browser on your phone, whichever you're more comfortable with, and go ahead and type in pollev.com/PFDD. Our first question for you this morning is we'd like to know, are you someone living with ALD, a caregiver of someone with ALD, or C, both a patient and a caregiver? So we're going to give you a few moments to get into the system. Make sure you answer this first question. As the day progresses, the questions will become progressively maybe a little harder or trickier to answer. But we're going to spend a little bit of extra time on this first question just to make sure that everyone has a chance to get into this polling system. So that way we can track your responses throughout the day, as well as be able to provide those in the Voice of the Patient report. As it stands, it appears that about 2/3 of our audience are patients, people living with ALD, any of the various forms that have already been described. We see about a quarter of our participants today are caregivers of someone living with ALD. And then we see about just over 15% of our participants are both a person living with ALD who is also a caregiver of someone with ALD. So we'd like to hear from all of these perspectives throughout the course of today's meeting. So thank you for answering this first polling question. We now go to our second polling question for this morning. Here we want to get a sense of where our participants reside. If you are, at this point on, if you are a caregiver and only a caregiver, we'd like for you to respond to the rest of today's questions, focusing on the person with ALD that you care for. So here we want to know, where do you currently reside? So in this case, it's probably the same place as the person that you care for. But the options are A, in the U.S. Pacific time zone, B, the U.S. Mountain time zone, C, U.S. Central time zone, D, U.S. Eastern time zone, E, U.S. Alaska time zone, F, U.S. Hawaii time zone, G, Europe, H, the Middle East, I, Asia, J, Canada, K, Mexico, or L, some other country or region not otherwise reflected in the list of response options for this polling question. So we'll give you a few more moments here to let us know where you or your loved one with ALD currently resides. It's looking like the largest cohort is from the Eastern time zone, although we do have good representation across all of the, or I would say the largest U.S. time zones, all the way over to the Pacific time zone. We do have representation from both Europe, Canada, as well as some other countries and regions that are not listed here. This meeting is open to anyone, whether or not you live within the United States, so we'd love to hear from those of you who are tuned in from abroad. If we can go to our third polling question. So here, we would like to know, are you or your loved one with ALD, A, female, B, male, C, non-binary, D, if you prefer not to identify, or E, other? All right. We'll give you a few more moments here to answer this polling question on if you or your loved one with ALD are female, male, non-binary, prefer not to identify, or other. As it stands, although we're kind of seeing a little bit of movement back and forth, it's a little bit of flip-flopping, but it's a pretty, I would say, equal between our people with ALD that are represented today but by both patients and caregivers are male and female, about almost a 50-50 split, but we do have a small proportion of people reporting other. All right, if we can move to our final question for this first set of polling questions. Here we'd like to know, how old are you, or if you're only a caregiver, the age of your loved one with ALD. The options are A, 0 to 5 years of age, B, 6 to 10 years, C, 11 to 18 years, D, 19 to 30 years, E, 31 to 50 years, F, 51 to 70 years, G, 71 years of age or older. And so you're not, to our audience, so you're not shocked by what we're seeing, despite what we heard about some of the epidemiology of ALD, with today's meeting being focused on adult manifestations. We are expecting to see those adult age ranges be the ones that are primarily reflected here. And so what we're seeing is exactly that. As final responses trickle in here, we're seeing that the largest cohort of our patients that are represented today are in the 31 to 50 year age range, followed fairly closely by 51 to 70 year age range. However, we do have representation of the other adult age ranges of the 19 to 30 year age range and the 71 years of age and older group. So we have great representation here across all adult age ranges. So thank you so much for participating in these polling questions. Just keep this webpage open. We'll periodically be coming back and doing additional polling questions throughout the day. But at this point, I'd like to move us into our first topic for the day. As I mentioned a little earlier, we want to spend the morning really understanding from all of you living with ALD and caring for people with ALD, what it is, what that means, what are the symptoms and health effects of the condition, and how do they impact your daily life. So if we can pull up our discussion questions for the morning session. Here, this is to give you an idea of some of the things that we'd like to hear about throughout this morning. We'd like to know of all the different symptoms and health effects of ALD, of which we know there are many. We want you to think about what are maybe the 1 to 3 symptoms that have the most significant impact on your or your loved one's life. We want to know, knowing that these different symptoms can vary from day to day, we want to know, how does ALD affect you or your loved one on best versus worst days? We want to know how those symptoms and health effects change over time, and maybe how has your ability to cope with those changing symptoms changed over time. We not only want to hear about those direct symptoms and health effects, but also how that has impacted your daily life. So what specific activities that are important to you or to your loved one are you not able to do, or not able to do as fully as you would like because of ALD? And finally, while we know that there's so much to learn from what you've already experienced, we know that your future is on your mind as well. So we want to know about your fears, your worries, and your concerns for the future as you or your loved one gets older living with ALD. So to get us started on this first topic, we have a panel of your peers, people living with ALD and caregivers. We have Mary, Alan, Barbara, Eric, and Lori, who will be sharing their experiences. Mary, take it away.
Hello, my name is Mary and I live in Boston. I was first diagnosed with ALD 18 years ago, 6 months after I developed symptoms that disrupted my life. Then I had difficulty walking, serious balance problems, and very painful legs with spasms that disrupted my sleep. I was short of breath and so spacey, I couldn't do much, not even drive. My symptoms were so scary that my internist sent me to the ER and I was hospitalized. When I showed off my spastic gait in grand rounds, the neurologist thought I had MS. A few months later, I got my test results. The neurologist said women are carriers and men get the disease. Let's get all your male relatives tested. What about my symptoms? I asked. No answer. I was the first one diagnosed in my family. My parents lived into their 80s and neither one showed any ALD symptoms. My sister with ALD went to the Mayo Clinic in Arizona with serious balance problems. The neurologist told her, "We don't know what you have, but we can't treat it anyway." My internist had sent me to a psychiatrist, not a neurologist. It was traumatic. I couldn't control my body, and my internist called me a hypochondriac. I was relieved when I was finally diagnosed with ALD. My symptoms were life-changing. I went from actively running and playing tennis to having to think about walking. I had to learn to walk again, spending endless hours walking around big stores, clinging to a cart so I wouldn't fall, and focusing on my gait. With ALD, I have to think about walking. If I walk in the dark, I become disoriented. If I turn too quickly, I risk falling. I can't even walk and look at my cell phone or the person I'm walking with. A policeman stopped me for bad driving. I'd fail the heel-toe walk. I used to be athletic and graceful. Now I drop things and bump into things. My motto is don't fall. I went from hiking in mountains with very rough terrain to having trouble walking on soft sand, uneven grass, or even a plush rug. I'm an orthopedic wreck, so that heightens my fear of falling. If I fall, I break. I've got severe osteoporosis. I have to exercise at least 3 times a week, but my exercise program is complicated by several orthopedic injuries. My shoulder fractured in several places when I tripped, limiting my range of motion. One foot is totally misaligned after I broke several bones. I constantly struggle with balance problems, and I can't handle stairs without a handrail. It's only because I've made exercise my top priority that I've avoided a wheelchair. I have problems with frequent urination and frequent bowel movements and some accidents. I considered the options, drugs, Botox, etc. And I chose to learn pelvic floor exercises from a therapist who specializes in bladder and bowel problems. I've got glaucoma, which was probably caused by ALD. Fortunately, they caught my elevated eye pressure early, so my ophthalmologist started eye drops before my vision got too bad. On my bad days, I can barely walk. I rely on a 3-legged cane and I can't walk far. My walking gait looks uncoordinated. I bump things and drop things, and often I have trouble focusing. The hardest part is I can't predict when I'll have a bad day. Without warning, my legs weaken, my knee collapses, my ankle turns, or I spill something. Unfortunately, last month, my knee collapsed and I broke my patella, my kneecap. I dreamed that medical scientists would create a miracle cure for ALD. If not, hopefully they'll develop drugs to restore myelin and slow disease progression. For 18 years, my ALD has shaped my life. Because of my physical limitations, my bucket list has shrunk to fit in a teacup. I had visions of spending my retirement traveling, hiking in the mountains, and playing lots of tennis. Now I focus on avoiding falls and making sure that I'm never far from the restaurant. Thanks.
Hi, my name is Alan. I have AMN. Turning 8, I started getting sick repeatedly with high fevers and with seizures. My body was shaking in convulsions, and my big brother had to go to the fire station up the block to get help for me. It wasn't until something was noticed in me that was different from my siblings. My dark complexion was startling. Eventually, I was diagnosed with ALD at the Kennedy Cricket Institute, and every year I was heading to Maryland to get blood tests and MRI scans looking for any changes with deterioration of the white matter and the myelin sheath in my brain. They said it was a miracle because destruction to that part of my brain had halted with no explanation. When I was 10, my parents had to decide if I should get a bone marrow transplant. It was new for us ALD patients. It was a 50-50 chance of something good or bad to happen to me if my parents agreed to it. Around this time, too, I had a friend whose parents decided to do it. I ended up losing him. Complications from the procedure was fatal, and I lost a friend. With my family and I, we had to make several changes in eating. I was put on a low-fat diet, and I had to take Lorenzazole. It was nasty. With this, sometimes I had a fight with my mom to take it. I was not exactly adored with it. Besides that, my mom had to use GTO oil in all the cooking. It really was a drastic change for us to do this. My siblings had to eat what I could eat. For a while I was stabilized, but I didn't know what I was to look forward to in my teenage years or what changes I had in store. While I was stable, I could play basketball and run around. In my mid-30s and onward, my walking gait started getting progressively worse, till now, where my imbalance is horrible, with me swaying to one side over the other, and being a wall walker to gain stability. I'm so very cautious about my walking. I can't play with my nephews like I want to. My freedom of going out is limited, and I'm not able to join in sport or some other activity with my family or friends. I didn't get the opportunity to learn to drive because my doctor told me that my reaction time is slow. Walking with crutches and braces was a change. When before I was walking without them, or just used a cane. I started using these devices in my mid to late 30s. My walking is horrible. My therapist was concerned about my crooked walking and how it would change my alignment walking the way I did. My spinal cord would be crooked or worse. My legs weren't straight when I was walking, and there was no heel to toe proper form. I'm really more of a dragger with my right leg specifically. Also, I'm worried about walking outside with an accident about to happen, urinating or solid waste on myself. It really makes me take a second thought on when I'm eating or drinking. For instance, some time ago, I was walking to my sister's house some 15 minutes away. I made my stops to use the bathroom and relieve my bowels and pee. After that, I thought everything was okay and I continued my walk to my sister's house. But I was wrong. When I was approaching her house, my bladder let loose like a river, and I was drenched completely with urine. I sat down for a little bit, not going into my sister's house, going back home. That was one of several accidents in my life. Long trips are something I have to make sure my bladder is clear. As well, this problem also breaks up my sleep. Now concerned about falling outside and getting up again when there is nothing around me to raise myself up with my hand, I'm stuck there on the floor. So I really make it important to look around at my surroundings, uneven sidewalks, and what steps that I take. My walking is very slow, and what would have taken me 15 minutes with a normal walking gait has increased to 45 minutes to over an hour or more. At the age of 42 now, it has been hard for me. I woke up last evening to urinate with my urinal near me, so living with AMN really frustrates me. I hope all this information helps you in order to find new drugs, new pharmacology that could help us with this illness. Thank you.
Hello, my name is Barbara and I live in Massachusetts. My symptoms have increased over the years, always impacting my life. Symptoms started when I was 22 with pins and needles in my feet, hip pain, gait disturbance, balance trouble, extremely cold hands and feet and legs giving out suddenly, leaving me on the floor. When I was young, I would fall, bruise, and bleed, but I could get myself up and keep going. At age 31, when my symptomatic 9-year-old son was diagnosed with adrenoleukodystrophy, I was told that I carried the gene as well. When he was on the transplant floor, his doctor explained to me the reason for my symptoms was that I was a female with ALD. Guilt knowing I had passed ALD to 2 of my children and depression revolving around that, and knowing my continued loss of abilities would follow me my whole life. My little girl asked why I kept falling down and held my hand to help me walk, so I finally agreed to see a neurologist. She has witnessed her whole life what may one day be her future. I began to lose control of my bladder, which led me to limit fluids as well as wear a pad. I was also losing sensation when being intimate with my husband. Sensory losses resulted in cuts and bruises, yet me not knowing how they had happened. Symptoms and pain worsened, but being stubborn, I had hand controls installed in my truck and continued to work in and outside of my home. Uncontrolled leg movements, bathroom trips, and muscle cramps made a restful night's sleep impossible for myself and my husband. Falls became more severe. Spasticity worsened. A wheelchair became necessary in order to go out for any distance. My hand tremors caused my handwriting to become illegible. I finally agreed with my neurologist it was time to stop working. A fall resulted in a broken hip, which caused the loss of ability to ambulate more than a few steps. Head titration was managed by leaning my head on my hand until it wasn't. My speech became halting and quiet, and in times of stress, non-existent. It has been difficult to live with a rare disease with no FDA-approved treatment, only trying to put out fires as they arise. I have thought if I had cancer, at least people would know what it is and I might have a chance at a successful treatment. As each symptom has been added, I wonder what the next symptom will be, and will I be a woman who has cerebral involvement? Now swallowing impacts my living and my ability to get enough nutrition into my body. Dining was one last social thing I could still do. My husband misses us going out and feels badly eating food while I drink my meals using powders to make shakes. I've lived 40 years in pain and losing abilities, yet pushing through and pretending. Now I'm home alone all day. I had accepted I would not walk, but decided at least I would be able to do handwork, which I always enjoyed. Now with the tremors in my hands and head, it's difficult to do any of that. So for a person who was always busy, I am no longer myself. It's been like I have been melting a bit more every year. I don't like talking to anyone due to my speech. I can't eat without coughing and gagging. I can't stubborn and pretend my way through this. My husband has to do chores I have always done. I struggle with that as I'm a very independent person and not a person who asks for or accepts help. I have always earned my keep. It is difficult for him to walk the line as he knows how independent I am, but scares him to know the things I try to do I shouldn't. I fear I will be a complete burden to him. I am fortunate to have my family and a man who stays true to the in sickness portion of his vows. Thank you.
Good morning. My name is Eric Kegg, and I live in Lancaster, Pennsylvania, with my wife and two sons, aged 9 and 13. I'm a 43-year-old man diagnosed with adrenomyeloneuropathy, or AMN, and have been suffering with the progressive symptoms of this neurological condition for close to 15 years. The condition has affected a maternal uncle and two of my brothers. I'd like to share with you my progression of the major symptoms over time, how this condition has affected my life with relationships, career, and some of the future challenges that I worry about with progression of AMN. I have not ever told my story publicly like this, but I want to share how challenging and devastating this disease has been for myself and my family. I had a normal, fun childhood in the 1980s, and after high school I served in the Marine Corps for 4 years and returned home after military service to attend Penn State. I then went into law enforcement and served as a police officer in a local township in Pennsylvania. After serving several years, I began to develop symptoms of ALD such as spasticity. My running began to decline, and I started to notice some beginning stages of coordination and sensation issues with my feet and legs. Spasticity can be described as a constant feeling of tightness in the muscles and sometimes uncontrolled spasms. It really never goes away. This led me to having to leave law enforcement young in my career and in my late 20s. This was probably one of the most challenging times of my life. It's experiencing the beginning stages of AMN with symptoms that are tough to explain to your family and friends. Nobody can really understand what you're experiencing, and at this point I lost a career that I loved and had to move on. Also around this time I got married, and my wife and I were planning to have children. However, genetics counseling is needed and planning is required to not pass the condition on to the next generation. Since the beginning of onset of AMN approximately 15 years ago, I have gone from being able to run to using a cane and wheelchair to ambulate daily. I have experienced daily, weekly falls because the coordination, muscle atrophy, and spasticity in my legs has gotten progressively worse. I started using a cane while I attended grad school in 2011, and I started to lose my balance more and more. I couldn't get from my car to the classroom without tripping over my feet with foot drop and loss of coordination. The challenge of being embarrassed that you are tripping and having to walk in front of people is taxing on the mind. Also during this time is when I started to develop symptoms of bladder and bowel dysfunction. This is the area that is really not fun for anyone to experience, as you feel that you will wet your pants if you don't get to a restroom quickly. And when you get to the restroom, it is challenging to fully drain urine as the bladder is not working correctly with a neurogenic bladder. And when you cannot walk fast, getting to the bathroom in times doesn't always happen. My first son was young around this time, so carrying him from his crib daily was a challenge because I was having balance issues and was nervous to drop him or fall with him. I have 2 boys, and while I am very involved and can participate in many activities with them, and I like to focus on the things that I can do, there has been many times that I cannot participate because of this condition. There are many times where I have to sit out or stay behind because the activity we are doing is not accessible, so my wife will have to step in. Over the years, I have learned to deal with the bladder Botox, or the bladder through Botox injections and clean intermittent cathing, but it's still challenging. There are other challenges that come with AMN that most men would probably not want to talk about, with ED and other sexual dysfunction issues. I'm worried about disease progression and cerebral involvement with AMN. It's been a progressive condition for me, and then I have challenging symptoms developed. I learned to adapt to them, but then a new symptom comes or progresses, and you have to readjust to the new norm. In closing, AMN has been devastating and challenging every day for me. My family to stand by and watch, and it has affected every aspect of my life. Thank you.
My name is Lori, and I am the widow of my late husband, Mark, who passed away at 44 from cerebral adrenoleukodystrophy, otherwise known as ALD. I remember every detail from the day he died. It was a muggy and rainy June day, and I can't forget the images of him sweating and seizing from the 105-degree fever that he suffered from before he died. The death that he opted for because he was tired of fighting this relentlessly debilitating disease. We were only married 3 months when he learned adrenomyeloneuropathy had progressed to the most serious and severe form of the disease, which involved his brain, cerebral ALD. He knew what that meant, and I thought I did. Once the lesions took over his brain, disease progression was very fast. It only took 18 months for AMN to take Mark from the fun-loving and athletic man he was to the mostly expressionless, quiet man that he became. Before the cerebral complications, Mark suffered from progressive mobility challenges, including severe walking and balance handicaps, largely due to his AMN. He relied on 2 canes to walk and used a wheelchair for longer distances, like visiting shopping malls or going out to dinner. The balance issues that came with his AMN resulted in many falls, but over time they became more frequent, and 2 of them resulted in a broken shoulder and broken ribs. Those accidents had very complicated recoveries because he already couldn't walk well, much less take showers alone or cook for himself. Mark also had very little sensation in his feet and legs due to spinal demyelination, a direct result of his AMN. Over time, he no longer could walk on his own as his muscles frequently froze up and spasmed in place. He continued to develop more nerve issues and needed at least one person to help him transfer from his wheelchair to a chair or a bed. He could not walk up and down the stairs anymore, which further complicated his life and the demands on our family. We installed a hospital bed on the first floor to make getting around the house easier, but that also meant that he and I slept apart. This had a major effect on our marriage, and I slowly became his caregiver rather than his wife. There weren't many options my children and I considered when it came to Mark's care. We promised him and ourselves that we would do whatever it took to help him live a fulfilling life at home, no matter how long that would be. As his brain began to fail, I was forced to step back from my communications career, and we lived on savings for the rest of Mark's life. There was no way I could work as Mark's AMN demanded 24-hour care. Plus, Massachusetts doesn't pay spouses to care for their spouse, so we suffered tremendous financial distress. My then 18-year-old son opted to learn specialized PCA training to assist with transfers, sponge bathing, and toileting. The funds that he earned as a PCA, and also his first job, went back to our family to help cover food and basic expenses. We also learned how to portion Mark's food and safely feed it to him because he could not see, use utensils, or effectively chew. Plus, having cerebral ALD and AMN made him a choking and aspiration risk, so he needed supervision when eating and drinking. In addition to AMN, Mark suffered from hypothyroidism and Addison's disease, which require lifelong medications. These conditions made him more susceptible to infections, so we didn't leave the house often. Mark also had numerous urology issues due to AMN, which required intermittent or external catheterization, and as a result, he suffered permanent sexual dysfunction and recurrent urinary tract infections. This did irreparable damage to his bladder and kidneys, and he developed urosepsis 9 times in his last year of life. Every infection demanded hospitalization and resulted in more muscle decline and cognitive impairment. He struggled with vision neglect, speech problems, and word recollection. Much of his speech became gibberish. We think he knew what he wanted to say, but his brain was so compromised he couldn't vocalize it. He grew increasingly agitated with aphasia and became more socially reserved. The confusion that he suffered completing basic tasks grew, and our interactions with him became simplistic, as if we were talking to a child. The less complicated the task or conversation, the easier it was for him to understand and participate. Mark's cerebral ALD ruined his memory. Not just recalling events in his life, but people too. This was the worst part of this experience for me because he forgot who I was more than once. During one of his rehabilitation sessions, he asked me where his wife was, and I replied, "Right here. Aren't I your wife?" And he looked at me really confused and said, "She's here somewhere." And I asked him again, "I'm not your wife?" And he replied, "Nope, she's cleaning my room." And he meant it. He was starting to forget me, to forget us, and forget our life together. This was devastating in the moment that I knew my marriage was over. I cried for hours after this visit. My husband was disappearing, and there was nothing I could do but watch it happen. 3 years have passed since Mark died, and the memory of watching AMN grip its nasty claws into him still haunts my heart and occupies my mind. While I could spend the rest of my life thinking about the horrible symptoms of cerebral ALD and AMN, I instead try to remember that no matter how many times Mark fell, we found a way to laugh together as he got up. I think of the tears in his eyes when we got married, the smiles on his face when he completed marathons in his racing wheelchair, and how he inspired our family and so many others with his resilience and laughter and kind-natured spirit. He truly was a gem of a human being, and I will miss him and grieve his loss every single day for the rest of my life. I ask that you please remember our story and our tremendous unmet needs when you review new treatments for ALD and AMN. Thank you.
Wow. Thank you so much, Lori, for sharing Mark's life and journey with AMN, and to all of our panelists for being so brave to speak first today and share each of your stories with all of us. So now we're at the point in the agenda. It's our first opportunity to open up the discussion to all of you, our individuals living with the adult manifestations of ALD and their direct caregivers and family members, to share your experiences. If you'd like to share something about your symptoms and health effects and how they impact your daily life, we would encourage you to call in. The number you can call in at any point during our session this morning is 1-703-844-3231. Again, that number is 1-703-844-3231. We would love to hear you, have you live during the program today, to share some of the impacts of ALD in you and your loved ones' lives. But to get us started in thinking about these issues and getting some input and understanding the experiences of our full audience, we're going to go to a polling question. So for those of you who have been with us, you can go back to that web page browser tab that you had open on your computer or on your phone. If you've joined us, you can go to pollev.com/ALDPFDD. Again, you can just go to this web page and keep it up all day, and we'll be coming to different polling questions periodically. Again, it's pollev.com/ALDPFDD. This is for all of our patients and caregivers only. Here we want to know, which of the following ALD-related health concerns have you or your loved one ever had? And please select all that apply. The options are A, adrenal insufficiency, B, balance issues, C, foot drop, D, altered gait, E, impotence or other sexual dysfunction, F, incontinence, either both bowel and bladder, G, pain, H, weakness or paraparesis, or the inability to move legs, I, spasticity, J, tingling, numbness or impaired sensation, K, depression, or L, some other ALD-related health concern that you or your loved one either currently or have previously experienced that's not otherwise listed amongst these options. As we see these results trickling in, this is our first question today that has allowed our participants to select more than one response. So what you're seeing is a percentage of the total responses. It does not represent the percentage of people who have selected any one response. So think of these bars as a ranking of sorts. What we are seeing is that perhaps the most commonly experienced ALD-related health concern amongst our participants today is balance issues. However, there's many with kind of high rankings that follow that, including altered gait, spasticity, incontinence, foot drop, weakness, and paraparesis, followed pretty closely by depression, impotence, and adrenal insufficiency. So really everything is pretty commonly experienced, and we're also seeing a number of other things listed. So we would love to hear about this range of different ALD-related health concerns, as well as some of those other ones that people are mentioning. If we can now move to our second polling question, you'll see here that we have the same response options as before, but whereas previously we wanted to know about everything that you've experienced, here we want you to think about this and select the top 3 that are the most troublesome ALD-related health concerns that you or your loved one have ever had, and you can select up to 3 of those that represent those most troublesome concerns. The response options are adrenal insufficiency, balance issues, foot drop, altered gait, impotence, incontinence, pain, weakness or paraparesis, spasticity, tingling, numbness or other impaired sensation, depression, or other. Please let us know which are the 3 that are most troublesome to you or to your loved one living with ALD. Give you a few more moments here to think about this, get your responses in. I think it's clear that perhaps the top most troublesome symptom being reported is balance issues. And then the second most common health concern being reported is the incontinence, both of the bowel and of the bladder. It's hard to say that it's a clear third, but we see a clustering of some other symptoms that are perhaps around number 3 together, including the altered gait, pain, spasticity, sexual dysfunction and impotence, and weakness and paraparesis. Although importantly, what we're seeing is every single different health concern here is in some number of people's top 3 most troublesome concern, really representing that not only are people experiencing many of these different health concerns, as we saw in the previous question, but many of these are really troublesome for people. And that's what we want to hear about from each of you today. We hope you'll call in and share which of these you selected and why that is. And you can also write in. So if you look under the live stream today, you'll see that there's a comment box. We encourage you to write in with comments as well. And we'll be reading out some of those comments periodically throughout the session. So thank you for those polling questions, answering those polling questions, and giving us a sense of some of the things that have been most troublesome to you. Again, if you'd like to call in and maybe talk about your selections and why you made those, I encourage you again to call in at 1-703-844-3231. Again, that's 1-703-844-3231. We'd love to hear from you. To get us started, as part of this live discussion, I'd like to welcome now a group of your peers represented here on Zoom, people living with ALD and caregivers who are going to be sharing some of their experiences and perspectives. So I'd like to start maybe with Jana, thinking about this first kind of pair of questions, the range of the different health concerns, but then of those, which actually would you consider most troublesome if you had to try to narrow that down? I know it can be difficult. So Jana, I'd love to hear your thoughts.
Hi, I'm Jana from California. I am 51 years old, a symptomatic woman with ALD. I started getting my first symptoms when I was in my late 30s and was diagnosed at age 45. I'd say that my top challenges right now are gait and balance. And really, it starts first thing in the morning when I wake up. My legs are so spastic, I can't even put any weight on them. In order for me to even get from my bed to the restroom, I use a knee scooter. And then pretty much every day, I have to start my day with a series of stretches just to decrease that spasticity. I stretch for about 20 minutes, and that allows me to be able to put weight on my legs and take a few steps. I'm able to walk in the house unassisted, but once I leave the house, I use a knee scooter.
Sure. And Jana, so does that, as the day goes on and as you've stretched, do you notice that, the balance or being able to, the gait, get any better, or is it really, any change maybe in the worst direction maybe as the day goes on?
As long as I keep moving, I'm able to keep my muscles a little bit relaxed. And all of my friends, it just doesn't make sense to anybody why they always tell me, sit down, take a break. But that's the worst thing for me, because once I sit, everything gets spastic. And then I've gotten to the point recently where the only way I can describe it is I'm nearly paralyzed. When I first get up, I even have to use my entire body weight to get on the knee scooter. I take a few swipes with it. Within about 5 minutes, I can start to move a little bit better. But as with ALD, everything that goes along with it, none of it really makes sense. And then as the day progresses, as I get tired, my gait just gets sloppier. And even to the point where 2 years ago, I fell just walking down the hall in my house, broke my foot. I've had 4 surgeries on it. And that's just having ALD and trying to recuperate from a surgery is just another completely crazy thing.
Yeah. And, are there also, better or worse days? And when you wake up in the morning, is there any way to predict whether, it's going to be a better or worse day for your kind of gait and balance and spasticity?
No, I would say most days are pretty similar.
Okay.
And again, just, I mean, sometimes I already know today, after I've been sitting watching this Zoom for several hours,
Yeah.
I'm going to be in a heap of trouble trying to get moving. But I think another thing with ALD, you're constantly having to think and predict what's going to happen. Last night we went to dinner and I was actually walking okay, but I knew I had to take my e-scooter because if I sit while I'm eating dinner for 30, 45 minutes, I'm not going to be able to get up and get out. So that's another thing, just the anxiety and planning. I was once diagnosed with an anxiety disorder, but then I thought about it and I talked to my internist and he said, you know what, it's okay. You are trying to prepare in order to defend off potential hazards. So it's okay. I might have anxiety for other things, but there's just a lot of planning that goes on with this.
Absolutely. Well, thank you so much, Jana. I'd like to bring Tim into this discussion of this topic. Thinking back to that list of those different, health concerns. What maybe sticks out as most troublesome for you?
Thank you, James. I'm Tim. I'm 56. I was diagnosed with AMN at age 38. I'm married with 4 children, and 3 of them are girls. I'd say the most challenging symptoms are my mobility and my bowel and bladder incontinence. These greatly impact my activities of daily living. Many times I'm unable to leave the house due to a combination of these symptoms, either the spasticity that makes me unable to walk and move my legs, or the fact that I have bowel or bladder issues. I don't want to have an accident either outside the house. So it's been very challenging, particularly to walk more than 50 feet. I currently use a cane, and I also use bilateral foot braces or leg braces that help me with my foot drop. So I'm constantly worried about falling, and I've fallen several times, and most recently it led to me breaking my hip and having full hip replacement. So in addition, I have frequent visits to urologists and podiatrists to help with my symptoms.
Yeah. Well, Tim, for both of these kind of symptoms, have they worsened for you over time? You've kind of described, a bit of, now, not, having to be thoughtful about when and how you leave the house. But has that always been the case? What has kind of this, your journey to where you are today looked like?
Yes, the symptoms have worsened, particularly it's gone pretty rapidly over the last 2 years. As I said, I can't walk more than 50 feet without the help of a scooter or a wheelchair. And I use a walker at night just to go to the bathroom, which is frequent, sometimes every hour. So my spasticity has caused these leg spasms, which make it really difficult to sleep. And generally every hour on the hour I'm up, which that certainly impacts my day and, my relationship with my wife, my family, my friends, because of my lack of energy my impaired mobility and fear of falling. I'm always afraid of, an issue happening. So I would say my confidence in the most recent time has fallen off the cliff, and many times it's led to severe anxiety as well as depression.
Yeah. And since you were mentioning these 2 different kind of symptoms, but I could imagine that having them both at the same time may actually make each worse, or make navigating daily life more difficult having them both together. Can you speak to that at all?
Yeah, sometimes it leads to bad things. I'd say my worst days with these issues have led to some challenges. Most recently, I had 4 different hospital stays, 16 days in the hospital. And the first was osteomyelitis caused by my foot drop, which led to an infection to my foot. And they had to, amputate my toe to provide, further infection spread.
Yeah.
My urinary issues led to a UTI, but with AMN, it caused adrenal crisis. And I was rushed to the hospital with adrenal crisis and experienced some life-threatening complications, including heart dropping to extremely low levels. Wow. And lastly, my fall, and these are all in succession, my fall due to my balance and mobility challenges ended up breaking my hip and needing total hip replacement. And, I was laid up for still several months, and it's trying to get back to the baseline is difficult because of, my mobility issues.
Absolutely. Well, thank you so much, Tim, for helping us understand some of your experiences. I want to check in with one more of our Zoom panelists right now, Patricia. Again, staying on this first topic of, what aspects of ALD are most troublesome. What stands out for you?
I'm Patricia. I'm joining you from Ireland, and I'm a symptomatic woman with ALD. The principal factors for me are gait and balance, like the other people have said as well. When I'm sitting down or when I'm in bed, I don't think about it. I just think the way anybody else thinks, the way I used to always think. But as soon as I stand up, I have to make sure, can I feel my feet? Can I move on? So within the house, I don't use any assistance apart from I bounce off the walls in the house. I use the door jambs, I use the banisters, I use my house. I know it's amazing the detail about my house that I know about, that nobody else thinks about. And I also know where there's a mat that I must consciously think of raising my foot. And I need to lift my foot up sort of a foot off the ground, which it doesn't move that high off the ground, but that's what I need to do to clear the mat or whatever. Once I leave then the house, I use a cane, but I use a cane. A lot of the time I can walk I don't plant the cane, but then if I'm stopping or somebody's coming near to me, I will put it to the ground so that I'm balanced. I'm not going to fall over. So that's all fine most of the time. But then if something happens, somebody talks to me or, I get ahead of myself in my thought process, I can fall over. I spend so much time thinking about standing up and moving and keeping safe that when I get distracted, that's when I can come a cropper, I'm afraid. So it's a large issue all of the time for me.
Yeah, and maybe can you help me and the audience understand, kind of that needing to focus in order to not fall? Is that because you feel imbalanced? Is it because you don't have the sensation, so you're kind of needing to use other senses to kind of understand your body position? Can you maybe describe that a little bit?
Yeah, it's not that it's nothing in my head that I'm feeling unbalanced, nothing like that at all. I feel quite clear in what's going on.
Yes.
But if say a small child or a number of small children come near me, or if there's furniture I have to move between, that just, my brain goes into overload and I need to sort of plant a cane or hold onto the furniture and get past it. It's a very strange concept. It's not, something I ever came across before, but right. I've just learned how to get on with it, how to survive, how to keep on going, because I don't have any choice. Sure.
And have you noticed you've needed more of this kind of using support, of any and everything around the house, it sounds like, but also mobility assistance devices outside of the house? Has this been kind of a progression? Can you tell us a little bit about, what that has looked like over time?
Yeah. 10 years ago, I went to see a neurologist and eventually I got a diagnosis. I presented to him as my family history. Unfortunately, my two brothers died from ALD, but I was fully tested for MS and everything. But eventually it was decided, yes, I am a woman with symptoms.
Yes.
But I was fine. Okay, people would say to me, had I hurt my leg, they would comment to me and I would fall from time to time. But it has increased then over the years that I have decided I need this cane. Part of it is it just stops people asking me questions. They go, "Oh, you're obviously something wrong with you. You have a cane."
I see.
And also, what the good thing is, they walk further away from me, so I'm less in fear of them. Believe it or not, it's kind of a strange concept. But so I have used, as I say, I used the cane. I did use a crutch initially because I'd broken my ankle along the way,
Right.
but I've moved on from that to use a cane because I think it means I'm using my legs more evenly, and I think that's better for me to use my muscles as best I can.
Sure. Well, thank you so much, Patricia, and we'll be checking in with our Zoom panel here periodically. I do see we have a phone caller. We have Emma from Massachusetts, who's the caregiver of her mother, who is a symptomatic woman with ALD, and Emma would like to share some of her mother's experiences with ALD. So, Emma, welcome to the program. Are you with us?
Yes, I am. Thank you so much, James.
Yeah, thank you. Well, would love to hear from you some of the top symptoms or impacts of ALD for your mom.
Yeah, definitely. So my mom is 53 years old. She started developing symptoms in her late 30s, mostly with incontinence, and then balance and gait later on as well. And her progression was pretty quick in terms of balance and gait. She went from using canes to the next year using a wheelchair pretty much most of the time. So I would say balance and gait are the big symptoms for her, as well as incontinence issues. A good example is we went to the movies last weekend, and she had to use her wheelchair just to be able to actually get into the movies. And there are a lot of people who necessarily don't see why a woman who still looks pretty young should be in a wheelchair. We passed a group of little kids, and this girl turned to her mom and said, "Mom, why is that woman in a wheelchair? She looks so young." So that's just kind of the things that we face every day with people not really understanding why she is the way she is. Sure. And, you also mentioned some of the incontinence issues. I'm just wondering, how does that, impact your mom's daily life? What does that kind of look like over the course of a day for her? Yeah, definitely. So I really related to what Jana was saying about the anxiety of planning and having to plan out your whole day. There are definitely a lot of things that my mom has missed out on or not been able to do just because she needs to plan. If we're going to a restaurant, where is the closest table that's going to be next to the bathroom? Or how long could she sit in a car without needing to empty her bladder, things like that. So she does take medications for her incontinence issues, but there's definitely a lot of anxiety around planning a day out with us, the rest of her family, and how that's going to work for her. And can you maybe give us a little bit of a sense of what that looks like in terms of, and it may be so variable that it's, you can't give a clear answer, but, how long perhaps can she go without experiencing incontinence? Is there, some amount of, period of time where, she's more confident, or is it really unpredictable? Yeah, so if we know we're going to be in the car for a little bit or we're going somewhere, she won't drink any liquids for hours before, just because she's so nervous about the incontinence issues. So she'll plan her liquid intake for the day. Like, she won't drink water or tea or anything. But it is variable how long she can last without needing to use the restroom, just based on how much liquid she consumes during the day. Right. One last question I have for you, Emma. You did talk about some of the kind of, maybe stigma or misunderstanding by others in the public, kind of looking otherwise, healthy, but being in a wheelchair or using another mobility assistance device. How has that affected your mom? And, does she want to avoid, public settings at all because of that? Or how has that maybe, changed, her mood or self-identity at all? Yeah, I think there's a big issue with stigma around people who use wheelchairs and just in general with ALD, because it's such a rare disease. So if you mention it to someone, they won't necessarily know what you're speaking about. So I think she does definitely get nervous to go out in social situations, or sometimes nervous about what people will say. She does a really good job, though, of just trying to be herself and not really caring what other people think or say. Sure. But that does definitely have a big impact on her daily life in terms of anxiety in social situations, or anxiety if she has an accident and what people will think or what they'll say about that. Okay. Wow. Well, thank you so much, Emma, for calling in. This has been so insightful to hear about your mom's experiences. So thanks for being a voice to that.
I also see that we have quite a few written comments that have been coming in from our participants. So I want to check in with Kathleen. Kathleen, what are we seeing in terms of symptoms and health effects?
First, I would just say thank you so much to everyone who is filling out the form and sending in your comments, both before the meeting and today. There's just so much. First, I have a comment from Charles, who's an adult cerebral ALD patient. And he says, issues for me are, one, I have become a burden to my family because I am no longer able to walk. I have no balance or muscle control. Number two, up until 2 years ago, I had a fairly active life. I was able to walk, golf, and travel with some limitations, such as falling down on the golf course and airports due to balance issues. 3, I have been in a wheelchair for the last year because of the lesion on my brain that was found 1.5 years ago. I am unable to do simple tasks. I can no longer type, have double vision and slurred speech, eat with a spoon, and have some swallowing issues. I am only 71 years old and don't know how much time I have left. This disease is devastating. It is hard on the patient, caregiver, and family. Please continue focusing hard on the disease for trials, new meds, etc. I am sure it is too late for me, but I'm hoping something can be done soon to help those with this disease. And then, and I apologize in advance, there are so many, I'm not sure I can get to all, but Amy from Maryland, a symptomatic woman with ALD, said, some of the most challenging symptoms for me as a symptomatic female are pain, something severe that is often blown off by medical providers, bladder and bowel dysfunction and balance, proprioception, and inability to walk well or run, especially in an emergency. And if I may give one more. Rachel from Holland, Michigan, another symptomatic woman with ALD, said, I'm 27 and I've had symptoms since elementary school. I wake up in pain, leg pain, back pain, bladder pain, fatigue, and so many other little things. Before I do anything, I get up and struggle to the restroom to deal with bladder issues. Then I take about 10 medications with a breakfast shake. None of them cure me, but they make it possible to get through the day without needing narcotics. It takes at least a half hour for the meds to kick in, and then maybe I can do a few chores or go grocery shopping, but not both, even on a good day. My capacity to do those things has fallen over time. I get exhausted and clumsy as the day goes by, and I find myself pulled away from the things I love doing so I can rest and treat my pain.
Wow. Yeah, well, thank you so much for everyone who's been writing in. Those are really impactful experiences that you're sharing. So we want to encourage you to continue to write in. There is that web form below the live stream here today. You can continue to submit those. As Kathleen was mentioning, we probably can't read all of them today. There's so many we see that are coming in, but we will try to share as many as we can. So at this point, I want to broaden the discussion a bit. We've been talking and focused really on symptoms and health effects, but we know that those symptoms and health effects have lots of different impacts in daily life. We've already started to hear a bit about that as well. So I want to kind of explicitly bring that into the discussion. What specific activities of daily, bring that into discussion and talk about those specific activities of daily life that are being impacted. And to do that, we're going to go to another polling question. So if you can pull out your phones, go to that tab you have open, go to pollev.com/ALDPFDD, and we will actually ask you about this exact issue. So we want to know here what specific activities of daily life that are important to you or your loved one are you or they not able to do because of their ALD. And so this is maybe something that they're not able to do at all or as fully as they would like, but please try to select the top 3 of those that are important, that are impacted by you or impacting you or your loved one because of their ALD. The options here are A, walking, B, playing sports or biking, C, communicating, D, driving, E, eating independently, F, sleeping, G, being intimate with a partner, H, working, I, attending social events with family and friends. Or J, some other specific activity of daily life that's important to you or your loved one that they or you are not able to do either at all or as fully as you would like because of your ALD. We know that probably many of these are impacted, but we're asking that you select up to your top 3 that are important to you that are affected. So we'll give you a few moments here to think about this and pick those activities that are important, that are affected due to ALD. As it stands, it looks like walking is the top kind of ranked specific activity of daily life that's important, that is either not able to be done at all or is fully due to ALD, followed by playing sports or biking, as well as sleeping being kind of in that second tier, along with perhaps attending social events with family or friends, so kind of a grouping of things that are maybe in that second tier. But then we're seeing each and every other one of these specific activities of daily life selected as top 3 for our participants, including quite a few of other activities. So we really want to hear about, these different activities, some of those others that we haven't listed yet. And I will ask that if you have something to share about, the different symptoms and how they're impacting your daily life, that you go ahead and call in. We'd love to hear from you at 1-703-844-3231. Again, that's 1-703-844-3231. But kind of as we're building, we're still talking about symptoms and health effects, but now, wanting to kind of more directly talk about how it impacts daily life, I'd like to check in with Aaron from our Zoom panel. Aaron, as you were looking at that polling question, what maybe were some of the things you selected, and why is that?
Yeah. Hi, my name's Aaron. I live in Washington State. I'm a 36-year-old male with AMN. I was diagnosed with that about 7 years ago. There are several areas here that I could have selected. I really identified with what Janice said earlier in this conversation about how oftentimes it's the combination of symptoms and their effects that is what is really life-changing. Even when you consider something just like working.
Yeah.
I had a career in advertising for several years, and I went to having to work part-time for a while, and then eventually made the decision to stop working entirely.
Wow.
Because of several things that people have already mentioned. Having to do stretches in the morning just to be able to walk, having to have close, quick and easy access to a bathroom due to, bladder and bowel urgency,
Yeah.
Physical pain as well, which can affect mental focus. I have severe neuropathic pain on a daily basis that I've tried to treat in many different ways. So it's really the all-encompassing aspects of living with ALD or AMN that I think affects these activities and ability to participate in them.
Yeah, well, thank you, Aaron. So, I'm very interested to hear, because you talked about, this constellation of different symptoms and health effects, kind of the mobility, incontinence, neuropathic pain, ultimately leading you to the decision to, stop working. How, maybe would you describe, how those symptoms were impacting you before you made that decision, and, in terms of your work day? And then ultimately, can you tell us a little bit about that decision to stop working? Kind of what was maybe, what finally made you make that decision to step outside of the workforce?
Yeah. First, I would say that, the symptoms have progressed over time, as they do for many of us. And so initially, it wasn't so much of an issue, and then it just kind of became more and more difficult as the years went on. My earliest symptoms that I probably developed in my late teens or early 20s, balance issues. That was probably my earliest symptom. But then, things just kept being added on: neuropathic pain, bladder and bowel issues, fatigue.
Yeah.
I basically selected every single symptom that was offered in
Yes.
the first polling question.
Mm-hmm.
Every single one of those affects me to varying degrees.
Wow.
And to answer your second question, the decision to finally stop working, I mean, it was a difficult one because so many of us, we find our identity in what we do. I think that in American culture, that's a very, very common thing. And so that involved, talking with my family, talking with my wife, talking with friends who had stopped working or stopped working that had gone on to disability for different reasons, and kind of finding a community with that. To be honest, it also involves speaking with a counselor as well, and kind of getting some help in evaluating how that decision would impact my life, my family's life. And that was something that I really found helpful in trying to evaluate and finally make that decision.
Yeah. And now that you've made that decision, have you been able to continue to kind of cope with that decision and kind of even how your life's been impacted, since then?
Yeah, I mean, my life is very different from how it used to be before I developed symptoms, but I still try to live as full of a life as I can. I have 2 young children that I share with my wife, and taking care of them, I'm not able to get them, out to do all of the things that somebody who is able-bodied might be able to do. But I think that it really is about focusing on what we can do, what we still can do, and trying to live the best that I can. I know that I mentioned earlier about having seen the counselor, and it's still something that I do periodically.
Okay.
One of the really big ways that has helped me personally is I used to struggle with feeling like I couldn't be fully present in specific moments throughout the day because I was distracted by, distracted by pain, distracted by fatigue, distracted by balance issues, not knowing whether I was going to need a restroom. I mean, all the combination of these symptoms. Something that my counselor really, really helped me with was, she shared with me this idea that if you feel like you can only be 50% present, in the moment, at any given moment, just accept that that is the reality that you're living with, but do your best to commit yourself to that 50%. If that's all that you can do, instead of beating yourself up about it, recognize that's okay, that's my reality, but I'm going to commit myself to that as much as I possibly can.
Yeah. Well, thank you so much, Aaron, for sharing that. I mean, you've taken us a whole level deeper than I think. It's not just the physical, symptoms that you're managing and navigating, but how that impacts how you interact and are in daily life. So I really, thank you so much for sharing that.
Thank you.
Connie, we'd like to get your thoughts, about impacts on. There's so many different, things in daily life that we do, from simple tasks to these bigger picture things like working. And family and social relationships. For you, what would you describe as maybe something that comes to mind as some of the biggest impacts in daily life as a result of ALD?
I'm Connie, and I live in Alabama. I am here today representing Rex. I was his wife and caregiver. He has passed away in 2021 from cerebral ALD.
Yeah.
He was 62 at the time. So, yes, listening to all of you and the polling, I would have checked Rex would have checked every single symptom.
Right.
And then, of course, other being the cerebral, which took away his cognitive abilities. He was a brilliant man, pilot, a computer programmer. He, did everything. He was very active, and, to watch his cognitive abilities to be taken away was very difficult. someone who, never had to ask how to do anything. He, you know, in the end, could not do the simplest things and couldn't be left alone for safety reasons. But back when he, was able to, before the cerebral, I'd say yes, the spasticity and the pain, those things were, and then the bladder dysfunction.
Yeah.
They caused, like Jana said, you planned his entire day. He got up at least an hour and a half earlier than everyone in the family, just so that he could, stretch, do all of his activities, the bowel and bladder. And whenever he started losing those different abilities, the one thing that he hated the most was that I had to do those for him.
Yeah.
I distinctly, remember it took, him, he did a bowel and bladder. He had a suprapubic catheter. And so he cared for that as much as he could. Then I took over the care of that. The bowel program, I still remember when I said, okay, it's time for me to help you and with tears in his eyes, it took away his dignity.
Right.
That I had to do things to help him that, he hoped and wished no one had to do for him.
Sure.
So it took away his ability to care for his family. He was able to work on cars. He did all of our oil change of our cars. And this is a funny story. While he was still in a wheelchair, so he couldn't do our oil changes, but he would go out, he would make the appointment for our oil change. He would go out and put the oil and the filter in our front seat in his wheelchair and, tell us, okay, it's time to do the oil changes. And when he couldn't do that even, like I said, he hated that he could no longer take care of his family and we had to take care of him.
Sure. Well, thank you for sharing so much about that, Connie. I'm also curious, of course, you talk about, kind of the symptoms before the cerebral onset.
Yeah.
How did he or you all as his family first notice, the cerebral onset? And then, can you tell us a little bit about, that progression, how long and, what did that look like?
Okay. Unfortunately, Rex was not diagnosed with ALD until just over 2 years before he passed. And due to, when he got the diagnosis, no one knew anything about it. So we had to find the specialist and we found Dr. Eichler. It was in the midst of COVID. So we were able to meet with him virtually. And, Rex would talk and he was very smart. So he could cover some of the things. We noticed little changes in his personality at first. That, he just was, not his same type of personality. He was very frugal. And then he got where he was like, oh yeah, you can get that. Yeah, we can buy that. We can do that. That was a big change to us. And it's just some little things. And then he told us, he word search. He said he'd have to struggle to think of the right word to say when he had a very sizable vocabulary that, he did not have to think about what word he wrote poems, he wrote studies and articles. And so he started forgetting also how to do something on the computer. He'd ask me a question and I'd be like, ooh.
Right.
So we said, can we get an MRI of the brain? We think there's something going on. And then in July of 2020 is when our worst fear came true, is that he had the beginnings of the cerebral ALD. And because of his age and other factors, he was not a candidate for bone marrow or stem cell, which has not been successful with adults, except for, matches within families. And he didn't have a sibling. His sibling had passed away before he was diagnosed.
Yeah.
So there were, little symptoms of mostly personality and behavioral changes at first.
Right. Yeah. Well, thank you so much, Connie, for sharing Rex's story. And we'll be checking in to hear more from all of you. I do see that we have a caller. We have Ken from Pennsylvania, a man with AMN that wants to talk about some of the symptoms he experiences and how they've impacted his life. So Ken would like to welcome you to the program. Are you with us?
I am, yes, thanks.
Wonderful. So yeah, Ken would love to hear a bit about your experience with AMN.
Yeah, I mainly wanted to touch on pretty much the beginning of AMN. Like, again, I was diagnosed at age 31, and prior to that, I had lived a quote-unquote normal life. I was fairly active. I participated in a lot of mud runs, Warrior Dash, Spartan, runs like that. And I have family history, so I knew what ALD AMN was, but there takes a little bit of preparing the brain for that to come, especially when you're so active.
Yes.
And then when the gait issues started, now, mind you, I could still definitely go to those quote-unquote runs, but I would be doing a lot more walking. But at that point, I kind of just threw in the towel because it did become more difficult for many things. But it's really it's just something that you have to wrap your brain around, that your life is changing, and you just have to adjust and adapt, and that's what I did from the very start.
Right.
Again, my most of my symptoms have been a lot. Again, the polling questions. I think I can agree with Aaron. I selected every single one of those, which has all come on over the past 7 years or so as I've experienced AMN symptoms. But yeah, it's definitely, and again, I've had family history. I lost my oldest brother to cerebral ALD. I lost an uncle to cerebral ALD. So it's a lot to take in, but
right.
You have to prepare yourself mentally, I would say.
Right. And so Ken, because you were focusing a bit on like the onset of some of the gait issues when your AMN symptoms were first kind of appearing,
right.
How, could you maybe like share an example or describe to us, how you kind of noticed that, being as someone who's so active, would be interested to hear that.
Yeah. Tripping and falling pretty much over your own feet, if that makes sense. Or I said tripping and falling over nothing. That was a big thing at the beginning. I was tripping and falling quite often, and not really understanding why. Like, what am I? It was just, it's just the coordination in your legs that kind of seemed to start to go, and your one foot kind of goes in front of the other one when you don't want it to. And then as far as drop foot as well, I experienced a lot of drop foot, which also caused the tripping and the falling.
And did that kind of frequency of that happening, or maybe frequency of falling, is that something that like was increasing over time? Just curious about, are we talking about like, once every couple of days? Did this become a daily occurrence at any point?
Probably once every couple of days, and again, it did increase. I did get some orthotic AFO devices, which helped with the drop foot, and since then, it has been near as frequent. Again, I think that's part of the adjusting and adapting part of AMN, and and again, I wear those, and I wear them with shorts. You can fully see them, and I have some people say, "Aren't you embarrassed to wear those?" And I'm like, "No, I'm not embarrassed at all. Like, it's either this or I fall down in public and have people look at me, and I don't want to be drawn attention to, and but yeah."
Yeah, thank you so much, Ken. Thanks for calling in and sharing some of these different experiences that you've had. Really helpful for us to kind of better understand, including some of those early symptoms that you experienced. I do recognize that we also have a lot of written comments coming in, so again, I want to check in with Kathleen.
Absolutely. Well, thank you so much again to everyone who's participating. Patty from Pacific Palisades, California, a symptomatic woman with ALD, writes, I no longer can walk unassisted because of ALD. I wish I could play on the floor with my grandchildren, but I can't because of ALD. I missed out on babysitting my grandchildren because of ALD. ALD has impacted my relationships with my entire family and friends. And Barbara from Massachusetts, another symptomatic woman with ALD, writes, when I had to stop working, people congratulated me on an early retirement. However, unlike others who may finally get to travel and golf, I stay at home, unable to go independently, and my friends don't think to ask me along, as that means a wheelchair and someone who has difficulty speaking and eating, not the friend they used to know. I want to laugh and have fun too, but I no longer can have fun because of ALD. And then another issue that I'm noting in the comments that has come up is really kind of that stress and fracture of relationships. Eric from Delight, Arkansas, a man with AMN, said, after 3 to 4 years of becoming more symptomatic, my wife of 9 years filed for divorce. She stated that she had just lost her love for me. Part of this was because of the sexual problems. She wanted more than I could give her, and the loss of income I had once had some to do with it also. And Alicia from Guadalupe, Argentina, a mother and caretaker of an adult cerebral ALD patient, Matthias, writes, Matthias was never able to practice as a lawyer. His partner, with whom he lived for 7 years, abandoned him, and he had to give up all his dreams, leave his apartment, and return to his hometown.
Wow. Well, again, thank you to everybody who's been writing, and it's so important to hear so many of your voices as part of this discussion. I do want to check in again on this broad kind of topics of symptoms and health effects, as well as activities with our Zoom panel. Is there anything that maybe, we kind of hit on some of the top ones, but maybe something we haven't heard so much about, whether a symptom or a activity that's impacted that you would like to speak to? I saw Jana signal she has something. If anyone else does, just give me a little wave of a hand. But Jana, why don't you get us started?
Obviously, we all have real trials and struggles with walking. But I have to say that my worst days actually start the night before because sleep is a huge issue for me with spasming in my legs. Again, I start the day with stretching and I end the day with stretching for about 15 minutes or so. Try to stretch out my legs. I get out my massage gun, try to massage out the muscles, kind of get them settled. And I never have a problem falling asleep because I'm so exhausted from trying to walk all day long. But then a lot of times I'm woken up within about 15, 20 minutes with a severe leg spasm. And it's a big jolt that wakes me up. And I can sometimes turn to the side and put some weight on that side or put a weighted blanket on. If that doesn't work, I get up again, do the massaging, the stretching. Sometimes it'll work, but oftentimes I'm woken up every 15, 20 minutes throughout the night with these spasms. And you can just imagine that sleep deprivation just does not set you up for functioning, doing anything, specifically walking throughout the day.
Yeah, and every 15 to 20 minutes is definitely a lot. Is that something that is a nightly occurrence, or there's some nights that it is every 15 to 20 minutes, but other nights where you are able to get a little bit more rest? Kind of what's that variability look like?
I would say it's maybe a couple times a week. It's every 15 to 20 minutes.
Okay.
On a good night, like other people have mentioned, I'll wake up with bladder spasms. So on a good night, I'm up maybe every hour and a half or so. And I'm just used to it. And fortunately, I'm able to go back to sleep after that oftentimes. But yeah, it's a struggle. I mean, I feel terribly because I know I'm waking my husband up with all my tossing and turning. And, I think there's probably going to be a day at some point where we're going to not be able to share bed. And that he's really fighting me on.
Right. Wow. Well, thank you, Jana. Connie, I saw you wanted to add something here.
I wanted to say we got a adjustable bed that had separate beds for that very reason. So it was the type that, they were like twin beds, but they were hooked together. And that's the only reason, because the spasticity would shake the bed so much, at night that it would wake up both of us. Or if he got to sleep through the spasms, I would feel them. So we did that early on, not knowing what it was, but we knew that's how we could stay sleeping in the same bed. It was adjustable also. He found putting himself in a different position sometimes would help, alleviate the spasm, and he could get back to sleep easier.
Yeah.
So yes, the sleep was a constant struggle and caused the fatigue. And
I was going to say, what is that, fatigue or other impact, after a bad night look like? Is there?
Yeah, it made it difficult to work. He worked until about 3 years before he passed.
Right.
But it was a struggle. I mean, I know if he sat down, when he got home, he could fall asleep the minute he was always tired.
Right.
Always.
Yeah. Patricia, is there another impact of ALD you'd like to raise? I saw you waved your hand.
Yeah, just following on from Aaron and the work issue, the job I used to do, I am an attorney, but in Ireland I'm a barrister. So that's principally a person who goes in and out of the courtroom, running around the courtroom with your instructions, et cetera, And then pretty quickly I realized it's not a good look if you are falling on the way into the courtroom. Clients aren't happy. Solicitors who brief you aren't happy. And thankfully I've never fallen actually in the courtroom. I can hold on and perform whatever.
Right.
But I have fallen so many times going into court or coming out of court or on the way back to my office from the courtroom.
Yes.
But luckily I'm self-employed, so I can rearrange the work I do. So I am largely now attending hearings, virtual hearings, or doing paperwork or whatever. But it's not quite the career I had in mind.
Right.
But I'm lucky that I can, take these steps. So it does make a big impact on people's lives. Definitely it does.
Yes. Yeah. Well, thank you, Patricia. And Tim, I'm going to bring you in as the final one on this topic before we broaden the discussion again.
Well, I agree with all these things. Sleep deprivation and being fatigued all the time does have an impact. And I think what the biggest challenge that I and fear of is just the burden that I have become to my wife as the caregiver and my family. I would say, it's hard on them to see. Prior to this, I was an avid athlete and very active. So it's been really hard on my wife and family.
Yeah. I can't imagine. Well, thank you, Tim, for raising that too. I do want to, go now to our last polling question of the session. We've been talking a lot about, everything that you all, people living with ALD, have experienced, and your caregivers have been helping us understand that as well. But we do want to spend a little bit of time in this morning session also thinking about what is on your mind about the future. So if you can pull out, go to that browser tab or go to the browser on your phone, go to pollev.com/ALDPFDD. We're going to go to our final polling question of this morning session. And here we want to know, what worries you the most about you or your loved one's condition in the future? And you can hear, we would like you to select up to the top 3 things that are represent your greatest worries. The options here are A, symptoms will get worse, B, the development of cerebral ALD, C, the falling, D, the inability to continue working, E, the loss of the ability to walk, F, not being able to get out of bed unassisted, G, not being able to have children, children, the fact that your children will have to help take care of you. I, that your relationships will suffer with family and friends or partners. And then J, some other worry that you have that is one of your top worries for the future living with ALD. So we'll give you a few moments to think about this and pick those things that represent those greatest worries or concerns for the future. So as it stands, while some final responses are trickling in, it looks like the top worry for the future is the worsening of symptoms that you have now. We've heard a lot about those different symptoms that you are experiencing. So there is a concern about those worsening. We do see that perhaps as the second greatest worry being reported by our participants is the loss of the ability to walk. And then perhaps the third is the development of cerebral ALD. After that, we certainly are seeing selections across every single other of these worries, including falling and relationships suffering, but each and every single one of these, including some other worries. So that, at this point in the program, of course, we do want to continue learning about your experiences to date, but we do want to also hear about your worries for the future. So if you have thoughts on worries for the future, we encourage you to call in on this final topic for our morning session. You can call in at 1-703-844-3231. Again, that's 1-703-844-3231. We'd love to have you share your voice with us, share your experiences and your perspectives on worries for the future. But I'd like to, maybe here start. I know that we've already started receiving some written comments on worries for the future. Kathleen, can you share some of those?
Sure, absolutely. First, we have Sherry, a symptomatic woman with ALD from New York. She writes, "I'm constantly on edge, worried about what the next symptom will be, since none of this is predictable. There's always fear that I will end up paralyzed the way my mother did. She suffered from ALD for 10 years. Watching her go through that was devastating. I don't want my family to experience that. There's also always the concern that my daughter will become symptomatic. It's been a never-ending road to travel, and my family is still affected." And then Miranda from New York, a mother and caretaker of a young son with ALD, writes, "The threat of cerebral ALD is always there, even for AMN patients, and the deterioration from AMN can creep up at any age, as early as the second decade of life for some. If my son gets sick in childhood, he can be treated with a bone marrow transplant or hopefully FDA review pending gene therapy. The landscape for AMN treatment is much less concrete and so much more dismal. The most important thing that I can do today is sharing with the FDA that my son represents hundreds of pre-symptomatic boys that will one day grow up to be men, not unlike the men you have heard from today. This applies to a majority of the ALD newborn screening girls as well."
Sure.
And similarly, we got a message from Amy, a symptomatic woman with ALD from Maryland. She writes, "It is getting harder to deal with my diagnosis. Thankfully, my son was spared. As my daughter gets older, I fear for her future. Personally, I would love the chance to have one day without pain and to be able to run again and even just one more time. I recall a day recently when my son fell off his bike. I tried to run to him, but my legs just wouldn't work. I am struggling to accept that my future is likely only downhill from here."
Well, thank you for everybody who's been writing in with those comments. Please keep sending them in, and we'll continue sharing them here this morning. I do see that we have a caller. We have Jessie from New Jersey, who's both a symptomatic woman with ALD as well as a caregiver, and wants to share some of her concerns for the future, kind of being both a patient and a caregiver. So Jesse, I'd like to welcome you to the program. Are you with us?
Yes, I sure am. Can you hear me?
I can.
Oh, terrific. Primarily, I consider myself a caregiver for ALD, and like a lot of us, my son was diagnosed 15 years ago. I was told that I was just a carrier. And as the years have gone on, I've recognized that's not true.
Yes.
Unfortunately. So on top of taking care of my son, who's fully dependent, my symptoms have increased as the years have gone on. Just last weekend, I took my son to a music festival. He loves music and dancing, our whole family does. And when we got there, it all seemed fine until I realized with panic that we were in the middle of the outfield. There were people all around and coolers and lawn chairs, and it became an obstacle course. Every time Jack needed to get up to do something, or I needed to get up to do something, particularly use the facilities, which a lot of us with ALD, it's a challenge to know when our bladders are full, and we have a limited amount of time to get there. So as much as we love music and outings like that, and I've always promised our son we would provide him the biggest, broadest house that we can, things like that are becoming a challenge. So when you talk about worries for the future, I worry about moving forward if we're going to have to give up more things that we enjoy.
Yeah, and Jesse, you talked about how you're not just a carrier. You've had these symptoms that have onset and have been progressing. Are there any of those symptoms that you're worried will most make it difficult to help you, care for your child? Maybe help us understand that a little bit.
Sure. The bladder and bowel dysfunction are embarrassing, but they really only affect me. My biggest concern are my balance issues. Because I do care for my son, and although he has not lost the ability to walk, he does need assistance with everything, including bathing him, getting him ready for, getting him dressed, getting him ready for bed, everything. And if my mobility gets severely impacted, I'm really not sure how I can care for him the way he requires.
Right. Well, Jesse, thank you so much for sharing this perspective, and I think important worry that probably many in this community have. We saw how many people responded early on in the polling questions that they are both a caregiver and a patient. So thank you. I want to check in with our Zoom panel and maybe start with Aaron. As you're thinking about worries and concerns for the future, what is top of mind for you?
Yeah, I think it's really important to share how real the worry of developing cerebral disease is, particularly for men with AMN. I mean, there's a great community. I mean, ALD Connect, it does a great job of connecting. Symptomatic women have their own groups. Men with AMN have their own groups. We have monthly community calls that we participate in, and it really gives people an opportunity to develop relationships with one another. But one of the things that goes along with that is recognizing that something that we share in common is that every man with AMN deeply fears developing cerebral disease. And on a personal level, there's a friend of mine who several of us know. He was involved with ALD Connect. He and I met for dinner when he was visiting Seattle 2.5 years ago. We sat across the table from each other and had a very frank conversation, looking each other in the eyes and talking about the potentiality of developing cerebral disease and what that would look like and what we would do if it ever came to that. 2 years after that conversation at dinner with him, he had passed away from cerebral ALD. And that, it hits very close to home when you know somebody personally, when you have had a conversation with them, when, you know, you've talked about the possibility of this happening, and then it's happened. And it's something that is, it's always in the background of our lives, I think. And, you know, I'm the type of person who likes to be prepared and likes to have a plan and knowing, you know, what would the next steps be. And thankfully, I've been able to speak with doctors where, you know, at medical centers where they do bone marrow transplants and talk about that. But going along with all of that too, there's the worries about, you know, is my insurance going to cover this? For those of us who are on Medicare, you know, is Medicare going to cover this? Or are we going to wind up with a bill for $300,000 for this treatment? So there's a lot of unknowns that go along with all of that. Not only the direct ramifications of developing cerebral disease, all of the physical, cognitive complications that go along with that, but also the financial and the emotional and the familial aspects as well.
Sure. Thank you so much, Aaron. So insightful. We do have a caller that wants to speak about some worries about progression. We have Holly from Twin Falls, Idaho, who is symptomatic with ALD. Holly would like to bring you into this discussion. Are you with us?
Yes, I am.
Welcome. Yeah, would love to hear about some of these, worries that you have and about your family and about progression.
Yes, I'm concerned about the future, as I think we all are, that deal with ALD and AMN. I'm having more falls. I'm walking with 2 canes at this point. A lot of balance issues, spasticity, painful neuropathy, fatigue, and I'm concerned about falls. I've had quite a few falls. I'm concerned about falls. I'm concerned about getting through the day upright. And the future worries me. My husband helps me so much more. I'm not able to do the things that I used to do, just even around the house, not to mention activities outside the house and the walks and the hikes that we used to enjoy. But he's helping me more and more, and my concerns are being wheelchair bound and, will we have to move from the home that we love so that, it will be more accessible to me? What kind of in-home care I'm going to need, this, and I think a lot of us experience these thoughts of this is not really the life we planned for, or the retirement we planned for, with, basically him being a caregiver of me, having to fall more and more into that role. And he's wonderful and supportive, but also there's the guilt of thinking that he's going to have to do that for me. And, there is just a constant worry and fear about the future and what that is going to bring. And, and at the same time, you're trying to get through the day and through the night as comfortably as you can and stay positive, which is really hard on those bad days.
Yes. Yeah. No, I mean, Holly, this is really, powerful and important to hear. There's, it's very clear that there's so much that, you and your husband are managing and navigating day to day, and then just having to worry about, what the next day is or months or years, look like on top of all of that. It's so much. So thank you so much for sharing. I think I'll give the final word if we have any other written comments on this topic, Kathleen.
We do have many, but I was just going to share personally that as a fellow patient, That for me, I share that fear of not being able to take care of myself and my family. I have always identified as being a caregiver, and ALD Connect is one of my children. And to think that I would somehow not be able to continue on and continue the fight for ALD Connect, and also, you know, to take care of my house and become a, I know they would not say it this way, but to become a burden for my family. Not only because I have 3 teenagers who don't know how to find the laundry or the dishwasher, but in reality, that is just not what we had planned. So,
are there certain symptoms, health effects that drive that worry? The thing that you're worried about getting, you know, more significant or severe, or maybe something that might onset?
Sure. You know, I think I've never been the most graceful, and it has always been a situation where, you know, we joke that I couldn't jump over a pencil or a piece of paper, but, you know, I've noticed that my own physical abilities have started to deteriorate, and I think it's just hard to consider that, you know, I may have to join some of my friends, not only in using assistive devices, and I watch people heroically get around and get stuff done, but it's, you know, I think it's a combination of that and the constant over-planning and worrying about where I'm going. I don't look up when I walk, I look down because I'm making sure there's not a crack in the sidewalk that I am gonna tumble into. But again and again, knowing our community and counting so many AMN and ALD patients as friends and watching what they're going through, it's hard not to see what pathways may be in front of me.
Yeah. Well, thank you for sharing that, Kathleen. Yeah, at this point, we are at our time where we need to go to a break. We've had a tremendous morning session here, really understanding what it is to live with ALD and the adult manifestations. We've heard so many voices this morning, so I want to thank everybody who has participated, including our Zoom panel here that we've had, as well as our, you know, those of you who have called in and the many of you who have written in. So important. If you haven't had a chance to get through or submit a comment yet, don't worry, we will have a lot more to talk about in the afternoon as we discuss current and future treatments. But for now, we're going to take a 30-minute break. We'll be returning at 1 p.m. Eastern Time to go into that discussion of treatments. So for now, thank you, and we'll see you soon. Good afternoon, and welcome back to the externally led patient-focused drug development meeting on the adult manifestations of adrenoleukodystrophy. My name is James Valentine. I'm here with Kathleen from ALD Connect, and we had a great morning discussion really to understand what it is to live with ALD, how it impacts daily life, and even touch on your worries and concerns for the future. We're now moving into our second topic for today, where we're going to be talking about both current and future approaches to treatment. If we can pull up our discussion questions for the afternoon, these are some of the topics that we're hoping to learn from all of you, people living with ALD and their direct caregivers, as we explore this topic of treatments. When we talk about treatments in this whole afternoon session, we really mean that in the broadest sense. So of course we are talking about medicines and other medical treatments and procedures, but we're also talking about a broader range of things, including other types of maybe physical or speech therapy, mobility assistance devices and other medical devices, as well as maybe more holistic approaches and even lifestyle modifications. Really anything that you or your loved one do to make living with ALD a little bit easier, we want to hear about. And so as we're talking about those range of different treatments, we want to hear about what you're currently doing, as well as what you've used in the past. We want to hear about how well those treatments address the most significant symptoms and health effects of ALD, everything that you helped teach us about in the morning. In addition to hearing how well or maybe not so well some of those treatments work, we also want to explore some of the most significant downsides of those different treatment approaches and how those downsides affect daily life. This could include anything from side effects of drug treatments or recovery time from a medical procedure, or even the burden of needing to undertake a certain treatment approach or regimen. Anything that you would view as a downside, we of course want to hear about. Once we've explored this range of different current treatments that you have available, we're going to look at the end of the session towards the future. And while we would all like to see that complete cure for ALD, we do want to know what specific things would you be looking for in a next ideal future treatment. Or another way to think about this is, what if a new treatment were to become available to you? What factors would be important to you in deciding whether you or your loved one would use this new treatment? So to help us kick off this discussion on current and future approaches to treatment, it's my pleasure to introduce our panel, our second panel of the day. We have Janice, Ken, Julie, Harry, Cheryl, and Frank, who will be sharing their experiences as well as perspectives. Janice, take it away.
Hi, thank you for letting me share my story with you. My name is Janice, and I live in Vista, California, which is in North San Diego County. I'm a 65-year-old symptomatic woman who has ALD. There was no prior history of ALD in my family until my 8-year-old son, Sawyer, who after months of misdiagnosis had an Andersonian crisis, which led to him being diagnosed with the childhood cerebral onset of ALD in 2003. None of his doctors were familiar with the early onset symptoms like ADHD, recurring viral infections, strabismus, or migraines, nor had they even heard of ALD. I won't go into details here, but with no treatment options available, Sawyer only survived 6 months. That led to me, my mom, my daughter, and other male members of our family to get tested. The 3 of us tested positive, while fortunately, no other family members did. However, we believe that my grandmother's debilitating disc disease was caused by ALD, and my 55-year-old uncle, who had been diagnosed with debilitating arthritis and unknown brain disease, must have died from the adult cerebral form of AMN. Neither had been tested for ALD, and both died before my son was born. Newborn screening wasn't even available yet. I've had worsening symptoms over the past 17 years, and even participated in a clinical study in 2005 to determine if Lorenzo's oil might be beneficial for adult ALD patients. That study was halted after some patients had adverse reactions to the placebo. That is the only study that has ever been available to ALD women in the United States, and we were still considered merely carriers at the time. Thankfully, we are now referred to as patients, since it is known that the majority of females with the ALD gene will become symptomatic in the future or in their lifetime. Upon realizing my symptoms relating to ALD were worsening, they were quickly dismissed by my doctor and attributed to menopause, alopecia, stress, etc. So I got a new doctor. And I don't have alopecia. I have hypothyroidism as well as ALD. It is through my own research and diligence that I've been able to guide my physicians to prescribe medications that have helped my symptoms. I'm also fortunate to have found one doctor who thinks outside the box. She put my Metinex, a yet-to-be FDA-approved supplement of B vitamins normally used to treat diabetic neuropathy, monthly B12 injections, 5,000 IUs of vitamin D, and low-dose naltrexone. This in combination relieves some of my neuropathy, but I have since had spinal fusion surgery brought on by a synovial cyst. No one knows if this was ALD related, but because I now rely on pain meds, I can no longer take naltrexone. I also take Lyrica for nerve pain, alpha-lipoic acid to help with digestive issues, which is a common complaint among patients, and CBD oil to help with insomnia that is often brought on by leg spasticity and cramps. I have had to advocate for my mother's care, whose doctors had never heard of ALD before seeing her. At the age of 91, she suffers a great deal from back and leg pain and muscle weakness. Because of my urging, she now takes a cocktail of Lyrica, Cymbalta, baclofen, and Norco, for which she contributes to even being able to get out of bed in the morning. She lives in an assisted living facility and uses a motorized scooter, wheelchair, and walker to manage her mobility issues. But she is still in constant pain despite the many medications that she takes. I have been heavily involved in the ALD community ever since losing my son, and even started my own nonprofit foundation to spread awareness. I have many friends that are affected by ALD and AMN and have lost more to this disease than I can count. I know it is a balancing act for many patients trying to get relief from our symptoms, and that it is a constant concern for us. We worry that we may progress to the point where our symptoms will affect our quality of life more drastically, not only for ourselves but also our loved ones. I worry that my husband will be burdened with chores that I may no longer be able to perform. I worry about my mom falling, and I worry mostly about my 29-year-old daughter, who is thus far asymptomatic. But what will her future look like? I would like to see drugs and therapies developed that would help all patients struggling with ALD. I would really like the medical community and researchers to take a hard look at the ALD women's population of patients who have been overlooked for years. We are tired of being invisible. I would like to see a clinical trial to determine if the thyroid gland is affecting the female ALD population, as I know so many women, including myself and my mother, who are on medication. I would like to see drugs that are available for MS patients to be tested for ALD and AMN. And lastly, I would like to be included in any future conversations about ALD and AMN.
My name is Ken, and I live in central Pennsylvania, Amish country. However, I'm not Amish. I am 38 years old and was diagnosed with AMN at the age of 31. I'm the youngest of three brothers who also had the gene defect, along with an uncle. While early on the disease was so rare, it was often misdiagnosed. Together, along with Google, we became much more knowledgeable into what AMN-ALD was and where we would be going from there. Would I develop cerebral ALD quickly, or would I live a slow progression of AMN? This is one of the many mysteries. I then was put into touch to the specialist at Massachusetts General Hospital in Boston, where I learned so much more than what Google could tell me. That was the best choice I've made in this journey so far. I've been through a lot of challenges as the disease has progressed, in which I've learned to deal with as they came. One of the first challenges was walking and a drop foot, which had me falling quite often. After speaking to a few specialists, it led me to getting a prescription for an ankle-foot orthotics leg brace, which assisted in picking up my feet to prevent me from falling. I've been using the braces for about 4 years, and they have been one of the best aids to date. The braces on snow and ice proved to be a new challenge as the disease progressed, in which I added in a walking stick to help manage. When walking inside and out of the elements, I do rely on walls and other furnishings to assist with balance and gait issues. We jokingly refer to this as wall surfing. While the walking challenges has been my biggest symptoms to date, I do have some bladder symptoms, the biggest being an urgency, usually at the most inconvenient of times. I've been prescribed a drug from my urologist, Mybetriq, which has provided some relief. I am in total understanding this can be progressive, which may lead to catheterization to provide relief in the future. I lost my oldest brother to cerebral ALD at the age of 39. I recently watched another friend lose his battle with cerebral ALD at the age of 37. That alone has affected me on a mental note. Here I am living the same life they had with some of the same symptoms. I'm here and they are not. Wrapping your head around that isn't easy and has led me to some times of depression and thoughts of throwing in the towel to speak. It's hard to accept that there are no approved treatments to help the progression of cerebral ALD and that my future could be of that, developing cerebral ALD. I have been involved in a clinical trial for a drug that is targeted towards AMN patients. One of the key findings from the initial report was that those on the treatment group had less progression of cerebral disease. The drug has had little to no side effects on me, and knowing that this drug could help prevent cerebral disease, that's huge, and I want to continue taking it for the rest of my life. Speaking for me personally, and the most important treatment is of that will help prevent cerebral progression of ALD. I can adjust and adapt to AMN symptoms, but I can't do cerebral ALD. Sure, I like the ability to run again and be a track star to speak, but given that or the option to be free of cerebral disease, I pick the latter. Friends who I've spoken to who also have AMN definitely agree with that statement. I have become friends with several parents of children with ALD, and I want the best for them. This isn't a disease to be selfish. Sure, I would love something to fix all my issues, but if there was a development of a drug or treatment that could prevent them from developing AMN symptoms, I'm on board to help get that done. With all of this said, there are several clinical trials in the loop which are hoping to start within the coming years. I am hoping that these trials will be successful. The ALD community are some of the strongest people I know, and we deserve a big change in the future. There isn't most likely going to be a wonder pill that will fix all the issues. But even a change to just a few of the symptoms would provide a better quality of life. When I talk to friends about AMN ALD, they ask, is there a cure? Unfortunately, no, but we are hopeful. And I want to give a special shout out to Catherine Becker, who is a nurse practitioner at Massachusetts General Hospital. She's the one who told me to, quote, get your head out of the sand. And when I was in times of depression after my diagnosis and trying to figure it all out, those words meant a very lot to me, and I will always remember those words. Thanks.
My name is Julie. I am a female with ALD in New York City. In 2011, I was diagnosed along with my brother. As far as we know, we are the only ones in the family with ALD. My early symptoms were tight calves, falling and tripping, and some balance issues. These were sporadic, and I was not symptomatic until around 2017, when my gait and walking speed affected my daily routine. I walked as if I were in pea soup. My gait was uneven, and I began to walk as if I were drunk. I was not yet using a walking aid, but clearly everyone around me would get ticked off as to why a seemingly healthy person was walking so slowly and tipping over for no reason. This made me think of using a walking aid, not for my benefit, but for others. They needed a visual cue. That year, I purchased 2 walking sticks, one that folded up and one that didn't. I carried the folding one for some time without using it, and I felt better that I had it in case I did need to use it. I did begin using the folding one every now and then in 2018, but then I got sciatic pain in my back toward the end of that year. The sciatic pain was chronic. It became another dimension in ALD because the spinal doctors I saw could not understand why I was in so much pain when the MRI did not show anything significant. It seems that ALD just magnified the pain. In 2019, I had a few treatments, a cortisone injection, and when that didn't work, 2 medial branch blocks. These treatments would take about a month after the procedure for the medication to be fully absorbed into my system. The idea then was that the pain would be relieved enough for me to begin physical therapy. For me, none of the treatments worked. In the month after each treatment, the pain would return as if I had no treatment. After this, I did not see any other option for my back pain and was using my walking stick daily. I was ready to accept that this was how my ALD situation would go, but I was not ready to stop living as normally as I could. I continued going to the gym. I train in a boxing gym because I needed the outlet. I continued stretching. In reality, I'm flexible, but the spasticity makes it appear as if I have no range and flexibility. I'm also strong, but the pain in my back and ALD did not allow me to carry weights as easily as before. In 2021, I tried physical therapy for my back and related issues that developed, but I needed a therapist who was experienced enough to understand ALD or at least MS. It didn't work. In January 2022, we had a brutal winter. The freezing temperatures had become unbearable for my muscles, and it felt as if I could freeze in place. It felt dangerous for me to be outside for longer than 20 minutes. I ended up staying home the entire month of January. When I felt it was warm enough, I walked out into the neighborhood to have lunch. Somehow my sciatica went away. I had no sciatic pain. I still have back pain, but it's manageable with continued stretching. My treatment journey has been baclofen, working out, stretching, staying active, staying mentally positive, changing my diet by adding more natural, nutrient-rich foods, and removing processed foods. It's also good for me to understand how my body works and to be able to self-correct when needed, such as with mild scoliosis. I was taking 4-aminopyridine, the generic form of Ampura, which is prescribed to MS patients, but stopped because it only minimally helped while posing the risk of seizures. What I'd like to see in treatments or medications for females with ALD would be physical therapists who are actually trained for our symptoms and be available when we do a search. I'm also interested in medications that would help movement, especially after stiffness as a result of standing, sitting, or laying down for long periods. Many women have back problems. I know I'm not the only one. After using the walking stick for over 2 years, I can testify that it can cause back problems. Thank you.
My name is Dr. Harry Giorgio, and I'm an Associate Professor at the University of Melbourne, working as a medical research scientist for over 40 years. I'm 63 years of age and I've been diagnosed with X-linked ALD-AMN. My older brother George, 66 years of age, also has AMN. We both noticed unusual symptoms in our early 50s, but our symptoms and their course are quite different, even though we have the identical mutation in the ABCD1 gene. We were diagnosed 5 years ago following blood tests that showed elevated very long-chain fatty acids. Our mother, who lived to 91 years, had no obvious neurological symptoms of AMN. George developed an unusual gait that gradually became progressively worse over the next few years. He consulted several neurologists who failed to understand or diagnose his condition. At about the same time, I developed unusual bladder symptoms characterized by low urine flow and low pressure. My urologist confirmed that this was not due to an enlarged prostate and prescribed a drug treatment which I took for many months with no improvement in my symptoms. Eventually, it was decided that I undergo bladder neck incision surgery to help improve the flow of urine. Once again, this treatment failed to improve my bladder symptoms that were now becoming progressively worse. Today, my bladder control is very unpredictable, with frequent, painful, and extreme urge to pass urine, even though there is very little volume. While I see my urologist on a regular basis, the best advice has come from a physiotherapist specializing in pelvic floor muscle relaxation. Using various strategies, this has helped to improve urine flow and alleviate the pain associated with passing urine. My urologist has also suggested I try percutaneous tibial nerve stimulation that involves electrical stimulation, which has helped to improve bladder control in some patients. George has only recently noticed unusual bladder control, but his symptoms are still relatively mild. At about 60 years of age, George's unusual gait became pronounced and he was finally diagnosed with AMN. I was also tested and was formally diagnosed with AMN. My brother now has difficulty walking and requires mechanical aids and physiotherapy treatment to assist with balance and walking. He has tried both Botox and dry needle treatment to his legs with minimal or no improvement. Since my diagnosis in my late 50s, I have also developed an unusual gait. While I'm still quite mobile and able to perform all my daily duties, I have become very prone to trips and falls, especially on stairs or uneven surfaces. My balance has become unsteady and I suffer from painful whole body stiffness, cramps, and reduced flexibility. I regularly have physiotherapy treatment with deep massage of my legs, buttocks, shoulder, and neck. My physiotherapist has tried dry needle treatment to my legs and buttocks, but this only provides temporary relief of my muscular cramps. He has recommended various exercises to help alleviate the muscle stiffness and to improve my balance and reflexes. The cramps in my calf muscles are noticeable when I relax, but I've found that magnesium helps to reduce the cramping and aids with my recovery, especially after physical activity. Only recently, my neurologist prescribed baclofen treatment, and I'm hoping this may help further alleviate the muscle cramps. While walking is normally a subconscious activity, I now need to stretch my legs, take a few tentative small steps, and concentrate as I walk so that I lift my feet and avoid tripping on uneven surfaces or stairs. I find that the best treatment for me is to remain as active as possible, walking often, stretching, building strength, and improving my balance activities that I do regularly. Unfortunately, working from home during the COVID-19 pandemic has exacerbated my symptoms due to reduced physical activity. Both my brother and I regularly see an endocrinologist to test for adrenal function, but so far this is normal. I was prescribed poiglitazone for several months but saw no change in my symptoms. Given that over 900 different gene mutations have been described, with no correlation between the observed symptoms, their onset, or their progression, it is difficult to know whether any single drug treatment will be able to stop progression of disease. I am not aware of any clinical trials for ALD-AMN patients in Australia, but I would be willing to participate in drug treatment trials that may help alleviate my bladder symptoms or halt the progression of my muscular symptoms. Repurposing existing medications that have already undergone phase 1-2 safety trials would be an advantage to speed up progress. A drug that would help activate the ABCD2 gene could be one way of slowing or halting disease progression. Thank you.
ALD, the destroyer of life. ALD, the destroyer of families. My name is Frank D'Agostino. My wife Cheryl and I live in Mesa, Arizona. Tragically, we have lost our two sons to ALD. In 2005, our youngest son, Jason, an outstanding athlete, was no longer able to compete in basketball, volleyball, and track. He began to struggle with walking and balance. He had mild hemophilia, so we thought it might be a joint bleed. We knew nothing of ALD. After months of visits to doctors and specialists, we were referred to the UCLA Medical Center, where he was tested and diagnosed with ALD. What was ALD? We didn't know. Jason graduated from high school and went to Cabrillo College in Santa Cruz, California. Within a year, he was home living with us. Alcohol and drugs were his escape. He died February 2010 at 22. My oldest son, Justin, was devastated emotionally and spiritually. Justin realized that because he had the same disease, his future was going to be difficult. However, Justin was fiercely independent and wanted to live a normal life. He worked as a teacher and recruiter. He wished to pursue a degree in naturopathic medicine. He owned his own home and was very independent. He got engaged, but because of his disease, she broke it off. At the age of 28, he began to have issues with ALD, especially with his gait and walking, which required the use of a cane. He had problems with walking, balance, fatigue. First came the cane, then the walker, soon the wheelchair. Justin was very intelligent, and he began his extensive research on ALD. He knew about the Minorex trial, but decided he couldn't wait. This led him first to consider stem cell treatment. Nothing was available in the United States, so he went to Mexico. His first treatment had little success. The dizziness went away after the stem cell treatment, but that did not last. It was not enough, so he went back to another clinic in Mexico for more treatment that included stem cell, followed by several hyperbaric treatments. No results. He thought about treatments in Asia, South America, Africa, and Europe. Not as many restrictions as the United States. He investigated drugs. ALD continued to play more and more. Incontinence, leg pain, muscle spasms, and emotional issues. He also had adrenal problems, for which he took 2 drugs, fludrocortisone and dexamethasone. Justin decided on his own to begin ketamine treatment, combined with counseling for his emotional needs. He went to a clinic and paid out of pocket for the drugs. He did this on a weekly basis for 5 treatments. The ketamine treatment and counseling seemed to help, but the effects did not last. Marijuana also helped his emotional well-being. The disease was now progressing, and his independent living was no longer possible. He rented an apartment but had difficulty with mobility, using the bathroom since it was not handicapped equipped. He moved in with us at the age of 34. A major event occurred when the results of his brain MRI revealed extensive brain lesions. His brain lesions increased dramatically within the course of a year or 2. Justin continued to feel he could beat the disease. Unfortunately, this was not to happen. He continued with his studies and kept in touch with other AMN men, leading Zoom support sessions. Then we had a major change in our lives. While transferring from our car to the wheelchair, he fell to the hot pavement in Arizona. He sustained serious burns to his feet and his buttocks. He spent 3 weeks in a burn unit in Phoenix. He needed 3 operations, skin grafts, then to a rehab center, finally home. Nurses would come 3 times a week to treat his wounds. Cheryl and I would treat the wounds the other 4 days. His body was failing, and so we tended to his needs, shower, eating, cleaning. All the nurses began to see him decline. Breathing, choosing, swallowing, difficulty. This fall was caused by ALD and led to a severe decline in both his physical and mental health.
Our son was changing quickly. Loss of appetite, difficulty swallowing, difficulty breathing, loss of upper body motor skills, and loss of communication all took their toll on Justin. Justin died January 22, 2022 at 3 a.m. peacefully at the age of 37. ALD took our second son at this incredibly young age, and now we face a new challenge. Because of ALD, I am beginning to have problems with balance, walking, and incontinence. I am doing everything to fight the problems, exercise, balance, control, and walking as much as possible. But our future is unknown. Jason and Justin, in our heart, run with God.
ALD, the destroyer of life, and ALD, the destroyer of families. Thank you.
Cheryl, Frank, and all of our panelists, thank you so much for sharing you and your loved ones' experiences, not just with ALD, but helping us understand the range of different treatment approaches that you and they have employed, and also some of your preferences and thoughts about future treatments. We're now at the part of today where the second opportunity we have to bring in our live audience of patients and caregivers into the discussion here on this. First, we're going to focus on the currently available treatments. And again, as you just heard from our panelists, when we talk about treatments, we're really talking about the wide range of things that you and your loved ones do to try to make living with ALD a little easier, in addition to, of course, traditional medical treatments and approaches. If you would like to share some of your treatment experiences, I'd encourage you to call in. You can call in at any point in this afternoon session at 1-703-844-3231. Again, that's 1-703-844-3231. We'd love to hear about maybe what you've tried, how well that's worked, and kind of understand your treatment decisions. To get us thinking about this and understand the experiences of our audience, though, we're going to kick off this session with a few polling questions. So for those of you who have been with us throughout the morning session, you can go back to that webpage. It's www.pollev.com/ALDPFDD. Again, pollev.com/ALDPFDD. If you're a patient or a caregiver and you've just joined us for this afternoon session, we'd like for you to participate in these as well. You can pull up this website, keep this open throughout the remainder of our afternoon session, and we'll be periodically checking back in and asking you to answer some polling questions. So our first question for the afternoon is, what medications, both prescription or over-the-counter, have you or your loved one used either in the past or presently to treat symptoms associated with ALD? And here we want you to select all that apply. The options are A, pain meds, B, antispasmodics, C, bladder medications, D, bowel medications, E, Botox injections, F, sleep meds, G, investigational drugs or drugs as part of a clinical trial or even expanded access, H, corticosteroids, I, vitamins or supplements, J, CBD, or K, some other medication. We'll talk about other types of treatment approaches later, but for this question, we're talking about medication, so other medications. Or L, if you or your loved one have not used medications, either prescription or over-the-counter, to try to treat symptoms associated with ALD. This is our first question of the afternoon, and since this is a question that allows our respondents to select more than one response option, I'll just remind everybody that the percentages you're seeing are the percentage of total responses, not the percentage of people who have picked any individual response. So think of these bars as a type of ranking exercise. And as it stands, as we're allowing some final results to trickle in, it looks like the top approach that our audience has employed is vitamins and supplements, followed by the antispasmodics and pain medications, as well as CBD being maybe kind of the top tier, along with bladder medications and sleep medications kind of also in a similar tier, second tier after vitamins and supplements. We see that everything we've listed here is employed by a fair amount of people, and even investigational drugs in clinical trials. So we would encourage you not just to talk about your experiences with drugs that are available on the market either by prescription or over the counter, but we also encourage you to share your experiences in clinical trials. We do see that there is a smaller response rate of those who have not used medications. Perhaps if you don't use medications, you've used something else outside of medication. So we still are going to want to hear from you in this afternoon session. So we can go to our second polling question for the afternoon. Here, so now we're expanding it beyond medications. What have you or your loved one used to try to help manage the symptoms of ALD? Again, either in the past or presently. And you can select all that apply. The options include physical therapy, occupational therapy, leg braces, cane or walker, wheelchair, urinary catheter, speech therapy, acupuncture, counseling or psychotherapy, or other, something else that we haven't listed here that you or your loved one have used to try to help manage symptoms. Or K, none of the above if you have do not employ anything outside of medications to help try to make living with ALD a little bit easier. So we'll give you a few more moments here to get your selections in. It looks like currently that physical therapy as well as cane or a walker are kind of the top treatment approaches outside of medications. We're seeing that leg braces, acupuncture, counseling, and wheelchair use, as well as other things that we don't have listed are all aggregating together kind of as a second or third tier. But we do see each of these different approaches being selected, and nobody is reporting that they do no non-medical approach to trying to manage the symptoms of ALD. So we want to hear about these ranges of both medical and non-medical or medication and non-medication approaches to treatment. And we're going to get you to start thinking about all of this with our third polling question as part of this afternoon session. Here we want to know, how well does your current treatment regimen treat the most significant symptoms of ALD? So those things that you told us about this morning, the various different numerous symptoms, how well does this range of both medications as well as non-medication treatments together help treat the most significant symptoms that you or your loved one have with ALD? The options are A, not at all, B, very little, C, somewhat, D, to a great extent, E, if you experience complete relief from those most significant symptoms, or F, if you're not using any treatments, medication or non-medication. And so as you're thinking about this, I want you to think about why. Why am I saying that it's helped very little? What is my treatment goal? What symptoms am I hoping that these different treatment approaches will address? And how much did they address them, if at all? That's exactly what we would like to hear about in this afternoon session. We want your understanding of not just what you've used, but how well it's worked and what that has looked like for you. It looks like about half of our audience is reporting that their treatments help somewhat. A little over 40% are saying they've helped very little. We're seeing a little over 5% saying that they've helped not at all. And less than 5% saying to a great extent. We're also seeing less than 5% of people saying that they don't use any medications or other treatment approaches. So this question isn't applicable. So again, keeping this in mind, we want you to think about it. We want you to call in, write in, and share, your perspectives on these current treatments. And I'd now like to welcome our afternoon Zoom panel, who will also be helping us do the same thing. So maybe we can start with Emma. As you were thinking of both, again, it could be both the medication as well as non-medication approaches. Maybe we'll start with those things that have been, most useful and most helpful. What comes to mind for you?
Thank you. My name is Emma. I am 24 years old. I'm from Massachusetts, and I'm a caregiver to my 53-year-old mom, Laurie, who has ALD. I would say when thinking about things that have been very useful, what a lot of other people have said today is that we want to prevent falls, because lots of bad things can happen after falls. So in terms of non-medical, non-prescription things, my mom having a wheelchair has been incredibly helpful. She spends about 90% of her time in her wheelchair, just to prevent those falls, because she doesn't have very good function in her legs. in terms of thinking about prescription and medical treatments, I would say some of the things that have been the most helpful are Botox injections in her legs to try to help with spasticity and just general function as well. But those don't last very long. She'll get them once every 3 to 4 months, and it will be relief for maybe 2 or 3 weeks at a time. But after that, she's stuck waiting for the next treatment and then needs to spend 2 months kind of back in a bad situation where she doesn't really have any function in her legs and the spasticity is pretty bad. And then talking about prescription medications, she takes about 33 pills a day just to manage her symptoms of ALD, which is absolutely crazy that you need to take that many pills. But some of the medications she takes that are helpful are baclofen, gabapentin, darafenacin, just to actually try to mitigate some of those symptoms of ALD, like incontinence, gait, balance, spasticity.
Yeah, so maybe if I can probe a little bit, particularly on the Botox treatments for the spasticity. You mentioned that when she gets the Botox, there is some benefit for some amount of time. That benefit seems to wear off. Can you maybe help us understand, what is it, how do you notice that it's helping? And then also maybe how do you notice when it is wearing off? What does that look like? But we'd love to hear a bit about that, Emma.
Yeah, so when she first gets them, it helps, especially with her sleep. She has a lot of leg spasms in her sleep, which disrupts a good night's sleep. So it does help with her getting better sleep. But then when it's starting to wear off, we notice a lot more leg spasms. A good example, so she loves to cook and she's an amazing cook, and she will stand up from her wheelchair and stand at the counter and use the counter to brace herself. And her legs will start spasming so much that she'll knock her legs into the kitchen counter and start getting bruises and cuts all down her legs. And that's when we know that it's pretty much not working anymore.
Yeah, no, seriously. Thank you for helping us understand that. And then the decision to use a wheelchair to help prevent the falls. Can you talk a little bit about the decision to start using the wheelchair? What led up to making that decision? Just would love to hear a little bit about that.
Yeah, so her progression was pretty quick in terms of going from just using forearm canes to a wheelchair. It all happened within like a 1.5 to 2 year span. She just did not have good balance. Even walking into a restaurant, just using her canes was really difficult. So she started using a walker when we would go out places. But she can't really walk more than 50 steps with her walker. She gets really tired, her legs get tired, and she's not able to physically move them. So in terms of safety, just around the house as well, it just made more sense for her to use a wheelchair. And then also too, she didn't want to miss out on stuff with us. And sometimes that was really hard for her, that she knew if she used her walker, she wouldn't be able to do all the things that she wanted to do. So just having her wheelchair has given our family more freedom in terms of being able to go out and do things or just do more stuff together in general.
Absolutely. Well, thank you so much, Emma, for sharing those experiences. Tim, would like to bring you into this discussion as we're maybe initially starting on things that have been most useful, most helpful, maybe make life a little bit easier. What stands out in your mind?
Hello, my name is Tim. I'm 46 years old. I live in the Dallas, Texas area. I was diagnosed with AMN when I was 18 years old and remained relatively asymptomatic till my late 20s, early 30s. And my symptoms have progressively gotten worse in the last 15, 16 years. So I think that the things that bother me the most are the neuropathy pain and, the clonus, the myoclonic foot jerks, the constant twitching and leg cramping.
Yeah.
And so I've tried several things over the years for pain, a lot of anticonvulsant medications, gabapentin, Lyrica. I had to combine those with some SSRIs to see if I could get more benefit out of that. That didn't seem to work. I've tried baclofen, that seems to help a little bit. And then like Keppra for the foot jerks seems to help so I can sleep a little bit better.
Yeah, for those last couple of things you mentioned, obviously a lot of things that didn't seem to work, but where you did notice some those things that helped a little bit, I think, as you put it, what was that little bit? How would you kind of, describe that or define that?
Well, just any little bit of help or relief that we can get is worth it, and it's definitely worth trying something and risking some side effects just to try to get a little bit of benefit out of it. Like I said, I think most of us are willing to try pretty much anything we can to get a little bit of benefit, and just the twitching in my legs that keeps you up all night, the jumpy legs, just getting any kind of relief for that so you can get some sleep at night, and then try to combat like your fatigue throughout the day. That's been probably the thing that's helped the most.
Right. And is there like a certain number of times that you wake up that you're noticing is going down, or do you just notice that you feel more rested the next day?
I just the less time I wake up, and the fatigue's so bad, you don't really feel more rested, but you kind of know that you are. You got some sleep, and that's important. And although you may not feel it, but
yeah. Well, thank you, Tim. I'm going to come to Nikki and Ganesh here in a second, but I want to just remind our audience, as we're kicking off this discussion about current treatments, I do want to encourage you to both call and write in. As a reminder, there is that comment box under the live stream, so you can write in at any point. I already see that we are getting some written comments coming in on this topic, as well as you can call in, and that number is on the webpage that you're on. It's 1-703-844-3231. Again, that's 1-703-844-3231. We want to hear about, there's so many different treatments we had listed in this polling questions. We want to hear about, really all of them. So I really encourage you to please call in and share your personal experience with them. But now coming back to Nikki and Ganesh, as you're thinking about the range of different treatments and approaches, to try to make life a little bit easier with ALD, what kind of things have you found to be useful?
Hi, I'm Nikki. I'm from North Carolina, and I am a female with ALD. I have a mother with ALD and 3 children with ALD, including my son Ganesh here, who is a 21-year-old with who was diagnosed about 7 years ago with childhood cerebral ALD. Took us about 2 years to figure out what was going on. He was 12, diagnosed at 14, and lost a lot of his abilities since then. So we're just, we've been trying to just figure things out as we go, because they told us there's no treatment. By the time we found out, it was too late for a bone marrow transplant. And we were just trying to do a lot of research. And we give him a lot of supplements. We give him steroids for his adrenal insufficiency. I had to do a lot of learning very quickly. He was able to walk when we found out. Then he went from walking to a walker to a wheelchair to now a power wheelchair. We had to change our house. We had to move and have house modifications and a vehicle, an accessible vehicle. Yeah. And he has AFOs. He has a wrist splint. We buy all kinds of contraptions and things to try to, we're buying all kinds of contraptions. We do physical therapy. He has a baclofen pump for his spasticity. So we have to go every month, and he has to get that refilled every month. And that's kind of a process. It's hard to get him out, but it doesn't really help much. I assume it must be helping a little, maybe, but the spasticity is so difficult, and we have hired, I have an aide that helps me because I can't physically move him by myself. He's unable to move. He's unable to use his arms, his hands. We have to stretch his hands out. So just a lot of life changes. And once we get used to something, we think, okay, he's in a wheelchair now, we've navigated, and then he can't use a regular manual wheelchair. He slides out of it. And even with the power wheelchair, his legs get so spastic, he breaks the straps all of the time. So, but we're just trying as we go. No real guidance with the supplements, just I hear something will help and I give it to him. We give him diazepam, we give him baclofen orally as well, and other supplements that I heard are helpful, but I figure they can't hurt. So we'll try anything if it can help.
Yeah. So you talked a lot about the different kind of contraptions as well as making modifications to the home environment. I totally appreciate, Ganesh, that it's not actually helping with the spasticity, but are there aspects of daily life, things that having those contraptions, having made those lifestyle modifications that make certain activities in life a little bit easier, make them still more accessible, even though they aren't actually treating the underlying symptom?
Definitely the house modification, because we had to move very quickly. We had a house with we bought a stair lift that gave us an extra year in the house that we had. But then we had to move quickly to a house, the bedroom on the main level.
Sure.
And he wasn't able to go to school because he was sliding from his wheelchair. So the power wheelchair that I took a year and a half to get, we were rejecting, but we got it. And that makes life. This power wheelchair makes we're able to feed him. He slides off the sofa, he slides out, but you can see we strap him in. And so I think the power wheelchair is the biggest thing, and having the accessible van that we can take him places, because we can't take the power wheelchair in a regular car. So, we had to get a lot of things quickly, and it wasn't happening. Ramp, we had to get a ramp put in the house. What else, Gun? That makes life definitely a lot more accessible. An adjustable bed we got. And his AFOs, he has osteoporosis, so he has to have weight bearing, and the wheelchair he has to have weight bearing so the wheelchair can stand up. So as much as we can, several times a week, we try to have him in a standing position, to at least get some of that weight bearing.
Right. Yeah. Well, thank you both so much for sharing some of these things. I know it's sometimes tough to think of what's helping when there's something that's not obviously treating or improving a symptom, but I think you've already shed so much light into what can help make life a little bit more accessible. I do see that we have a number of kind of treatment success type comments that have come in. So Kathleen, what are we seeing?
Sure, absolutely. Brandon, a gentleman from Dallas, Texas with AMN, writes, "It seemed odd to be in physical therapy after my AMN diagnosis, but without a single instance or event to land me there. I'd never been before, and admittedly my initial thought was, how much could this really help? As it turns out, a great deal. While I was doing exercises that seemed mundane, I was quickly humbled by my inability to do them." And also Sheila, a symptomatic woman with ALD, writes, "With regard to my neurogenic bladder issues, I was prescribed to take Myrbetriq 50 milligrams and alfuzosin, 10 milligrams every night after my last bite of dinner with a full glass of water. Thanks to all these changes, I now only pee 7 times during the day instead of 11. I now only pee 1 time at night instead of 3, totaling only peeing 8 times a day instead of 14. I now only pee my pad maybe once a week, if that, instead of several. All these ALD symptoms have created a lot of problems for my life and have given me worry and anxiety. I will keep going and keep trying to adapt to any new changes that come along." And then Eric, a gentleman with AMN from Delight, Arkansas, writes, "I had an intrathecal baclofen pump placed back in October. It has been a life-changing procedure. I went from being so spastic that eating and breathing had become difficult. My legs had pretty much a complete mind of their own when walking, and even laying down quite often. Now my legs move much more smoothly. I can stand up straight. Eating and breathing have gone back to normal. I lead singing at our small church, and the Sunday after the surgery, I had to stop mid-verse because I was tapping my foot in time to the music. I had not been able to do that in over 2 years. And then finally, and not finally, I will say there are so many comments flooding in, but the last comment I'll probably get to here. Sherry, a symptomatic woman with ALD, wrote, I have severe burning neuropathy in my feet and legs and numbness in my toes. I had some relief from gabapentin for a while, but after almost 2 years, I began having stomach issues. I now take duloxetine, and it seems to be working well. However, additionally, neuropathy symptoms started last fall, and I was experiencing severe numbness in my feet and stinging in my legs. I would be awakened every night between 2 and 4 a.m. This went on for almost 70 days. I decided to start taking THC gummies before going to sleep. This has helped immensely. After months without a full night's sleep, I was finally sleeping well. The result is complete calmness, and I sleep through the numbness and stinging.
Wow. Yeah, well, thank you everyone for sharing those kind of treatment approaches that have helped. We want to keep hearing those. We do have a phone caller, I see. We have Patrick from Houston, Texas, a man with AMN who is going to share some of his experience with AMN and approaches to treatment. So Patrick would like to welcome you to the show. Are you with us?
I am.
Welcome.
Thank you.
Yeah, so would love to hear any thoughts you have about, any treatment approaches that you've tried. Is there anything that has been useful for any symptoms that you have, or or any thoughts that you have about those currently available treatments?
I have been on an exercise regimen for the last 3 years,
okay,
which has helped a lot with my stiffness. I've found that I really enjoy Pilates, and that helps me to stay on my feet. I work in the restaurant industry, so it's not an industry that lends itself to let you sit around for too much.
Sure.
And so I'm so thankful for my instructor who I'm able to get with twice a week. As far as my other symptoms that can't be overcome with exercise, I have tried some of the other medications that have been listed and have resorted to over-the-counter cannabis-based products to help with sleep as well. But what I found is with those products is that, you're on them and you feel great, and then once they wear off, the pain in your lower body tends to come back a little bit stronger. And so that's something that I would really love for us to be able to find a better solution to address the stinging and the numbness that really have an impact on our day-to-day, everyday life, because when you're in that pain the way that we are, you become so much more apprehensive with all of your movements, because we get to a point where we're not even enjoying our life anymore. We're spending all of our time trying to prevent the next major injury from happening.
Right.
And that's the message that I really wanted to share, was that there are things out there that we can do that can help us to compensate for our problem.
Right.
But at the end of the day, the problem never goes away, and it's in the back of our mind with every step that we take and every life event that we want to be a part of. We have to spend so much time strategizing how we can be a part of that without having a life-changing accident happen.
Right. And so for you, Patrick, the thing that maybe is most contributing to that risk that you have to be worried about and concerned about, is that kind of like hypersensitivity and pain in your lower extremities. That seems to be the thing that for you is kind of like the it would be your top kind of issue you'd want treated?
Yes, because it's not, walking to and from a space that I'm worried about tripping or anything. Yeah. It's that if something happened, my leg could completely contract and I could fall to the ground. And at that point, I'm at a much larger risk for a head injury, which could be severely detrimental. And so it's those extreme accidents that could happen that are so much more probable to happen.
Right.
Sometimes I feel like I should be walking around with elbow pads and a bicycle helmet.
Yeah.
Because, if I'm doing anything out of the normal, there's an increased chance of those incidents happening.
Yeah. Well, this has been really helpful, Patrick, putting this kind of your needs into perspective and helping us understand and appreciate what would be useful and helpful to you. So thank you so much for calling in and sharing. Now, I know so far we've been focusing, or at least I've been asking you, trying to say, well, what maybe has been most useful? But we do know that there's maybe things that we don't know if they're useful. Maybe we really feel that a certain approach is not helping. But even if something is helping, we know that oftentimes, even treatments that work come with downsides, whether side effects or, they're very burdensome to keep up with. So I want to expand the discussion. Of course, we're happy to continue to hear things that have helped, but also to understand some of maybe the negative sides of existing treatments. Like before, I want us to start thinking about this through a polling question. So if you want to open up that polling webpage at pollev.com/ALD-PFDD, we'd love to hear from you on this question of what are the biggest drawbacks of your or your loved one's current treatment strategies. So, kind of across the board, thinking about the different medical and non-medical treatment approaches you have available that you either have used in the past or are using currently. What are maybe the top 3 that are biggest drawbacks of those? The options are A, that they're not very effective at treating the target symptoms, so the things that they're intended to treat. B, they only treat some, not all of the symptoms. C, that they have a high cost or copay, or they're not covered by insurance. D, there's a limited availability or accessibility to those treatment approaches. E, there's side effects. F, the route of administration of the product or drug. G, it requires too much effort and or time commitment to keep up with that treatment or treatment regimen. H, some other biggest drawback, something we haven't listed as a response option for you. Or I, you can say that, select I if you're not using any treatment approaches, so this is not applicable to you. So as you're picking from amongst these, we want you to be thinking about, why are these the biggest drawbacks amongst what might be multiple issues? And we'd love to kind of, which of those different treatments are you really thinking of when you picked these responses? There might be a few things that are really driving your answer here. So as it stands, it looks like the top biggest drawback is that when a treatment is intended to treat a certain symptom, it's not very effective in treating that symptom. And then the other is, the treatments that exist are only, there to treat some, but not all of the symptoms. That's kind of the second biggest drawback that we're seeing. After that, we do see limited availability, side effects, and cost and access as big issues. And then some people did select that it requires too much effort or time commitment or some other things that aren't listed here. We want to hear what those are from you. Nobody selected route of administration as a drawback. And we did have a few people say that they are not using any different treatment approaches. So if you'd like to share your experiences, maybe some of the drawbacks or treatment approaches that haven't been so successful, I'd like to encourage you to call in or write in. You can, of course, call in at 1-703-844-3231. And that's 1-703-844-3231. Again, we want to hear about the wide range of different current treatment approaches. But to get us started, I'm going to come back to our Zoom panel and start with Jamie. Jamie, as you're thinking about both medical and non-medical approaches, is there anything that stands out as maybe something that hasn't been so useful, or maybe even if it has, it's come with some big downside?
My name is Jamie. I'm from Southern California. I was a caregiver for my son with cerebral ALD. He passed at the age of 21, 5 years ago today. I am a symptomatic female with adrenoleukodystrophy, and I'm 56 years old. Some of the treatments that I've done, most of them are to help with the neuropathy and the pain in my feet and legs. Is not very effective. I've tried different medications for gabapentin and nortriptyline or amitriptyline to help with the pain and stinging. It helps very minimal. I still have pain at about a level 3-4 with any weight on my feet and legs. I've had falls. I fell in January and broke my ankle, which required surgery. I walked on it for 3 days because I couldn't feel it because my neuropathy was so bad.
Yeah.
Even after surgery, I still felt nothing because of the neuropathy. So for the treatment for my neuropathy is not very effective to really even take care of the pain itself. And definitely has not helped with the numbness or lack of sensation or lack of feeling of my legs.
Yeah, and so, when you're trying these treatments to try to help with that, how long do you usually try a given medication? Do you stay on medications, even once you maybe initially don't feel like it's helping, but kind of to give it more of a chance, or maybe because there's not other options? You talk about some of your treatment decisions and how you navigate, this scenario where nothing has really helped so far.
I've continued with the neuropathy, and we've played with that up and down, and then adding different medications to it, like a nortriptyline, amitriptyline. I heard Tim describe one of the medications. I can't think of the name of it, but including the nortriptyline really started affecting the pain itself. The pain from the neuropathy was brought down by a good 50%. And I actually kind of glad that I still have some pain in my feet, because if I didn't have any pain in my feet, I couldn't walk and I couldn't drive. So I don't want to do more medications. I want to keep the pain in my feet, so at least I have some sensation and it doesn't take away my mobility or my independence.
Right. Yeah. Well, Jamie, thank you so much for describing, unfortunately, treatment experiences that haven't helped, and really putting that into perspective for us. I'd like to bring Ben into this conversation as we're thinking about current treatment approaches. Is there anything that stands out? Of course, if you do want to talk about something that has been helpful, but also on this, maybe things that haven't been helpful or come with some kind of downside.
Wonderful. Well, great to be with our great community today. So I'm Ben. I live in Palo Alto, California. I've been here for 3 decades. And I was diagnosed in my early 40s, so relatively late onset, after being extremely athletic and outdoorsy in my 20s and 30s. So really in the last decade, it's been a story of slow but inexorable decline, with mostly issues around 3 things. So one is gait and balance and the risk of falls. Number 2, serious bladder issues. And number 3, now chronic adrenal insufficiency.
Okay.
And in terms of what I use and the positives and negatives, so I take a daily supplementation of steroids, and basically the steroids are keeping me alive because adrenal insufficiency is serious business, and steroids are not ideal physiologically, long-term steroid use is harmful. And I've also initially dealt with issues around insomnia, some weird mood cycles.
Sure.
I'm on the experimental drug from Minorex Therapeutics, MIN-102. So I started the study in 2018, and I'm now in the open label extension. And the drug really no longer has any side effect and may be of benefit. I take CBD when I go to sleep to help with leg and bladder spasticity. And that's a little bit helpful. And I take antioxidants, primarily vitamin D and NAC and acetylcysteine, which I think can only help.
Yeah.
I would say the biggest help for me has been really exercise, sticking to physical therapy and rehab, and really being active and moving every day. So keeping the flexibility and the core strength. And then I also use 2 canes, occasionally use a walker, and I use an assistive device, which is like basically like a leg sleeve called the cyanic neural sleeve that gives functional electrical stimulation. And that's helped quite a bit with my foot drop and my hip flexion and to achieve better stride. But all this, considering that all these are mildly helpful, but they're at the end of the day not very effective and mostly palliative.
Sure. Yeah, describing the physical therapy kind of with exercise and some of the devices, including the canes. Can you describe why you would how for you personally those do help in that, I guess, as you described it, palliative way? Are there things that maybe when you aren't able to keep up with your PT regimen, if that has ever been the case, did you notice that symptoms or health effects of your condition worsened, or there weren't activities you were able to do as easily? We'd love to hear a little bit about that.
Yeah, so definitely, I have to move every day, and I'm lucky to be able to do so. And if I don't on any single day, I have more stiffness, rigidity, and spasticity. And so, of course, that's going to impact how I feel in the evening, my ability to go to sleep, to stay asleep. And so having a healthy fatigue from exercise through things like Pilates, as previously mentioned, swimming. I have a recumbent bicycle, but I'm trying to be kind of flexible and creative around what I do. But the ability to exercise every day and keep that core strength and flexibility and movement control are essential.
Absolutely. Well, thank you, Ben, so much for laying out your treatment regimen and talking about some of the things that help somewhat, but also still that unmet need that you have. I do see we have a phone caller, so I'd like to bring Tim from New Jersey into the discussion. We had heard from Tim earlier today talking about his experience with AMN, but would love to hear, Tim, from you about some of your treatment experiences that you'd like to share. So, Tim, are you with us?
Yes.
Welcome back.
Well, thanks. I'll just cover 2 things. One is for bowel and urinary incontinence, and the other is physical for mobility. So for bowel, and it impacts my urinary urgency, I use Miralax every night, and it helps. I never miss a night. If I do, it throws my entire day off. So simple over the counter. And from meds, I use really a few. One is clonazepam to help me sleep at night for my spasticity. But for urology, I use Gemtesa, which helps with urgency and has made a big impact. Doxycycline at night, which helps with keeping the flow. they kind of go hand in hand. It's a balancing act. And hyoscyamin with sulfate, which is, again, helps me at night with getting up less. On the physical side, just to help with my mobility, I just knew when I was diagnosed just to stay active, so I work out 7 days a week. I ride a Peloton bike, and I work out with a trainer, and I have somebody that helps me with stretching and occasionally massaging. And so, but working out every day, I really can't go through the day, much like Ben said, without getting at least 20 minutes to 30 minutes workout.
Sure. And so, you first were kind of talking about some of the urologic issues and getting through the night. When those treatments have helped, how would you describe or if you can, kind of quantify that for us, just so we understand, what that difference looked like?
Yeah, well, I would say best case is to wake up, 2 to 4 times a night. That's like best situation.
Okay.
But if I don't stretch, that can impact my spasticity, which wakes me up and makes me feel like I have to go to the bathroom. But it has less about urology and more about spasticity. So the clonazepam has helped, but stretching combined with the clonazepam has really made a difference.
Wonderful. Well, Tim, thank you so much for calling in and sharing some of those treatment experiences. And again, also this really interesting, I think, understanding, when you have multiple different body systems and symptoms at the same time, how you're trying to treat one, and then, there's the other is still there and complicating that. So really appreciate, again, your sharing. I do see we have some written comments coming in on kind of this treatment downsides topic. So Kathleen, what are we seeing?
Absolutely. First, we have a gentleman, Cameron, with a gentleman with AMN. He writes, NSAIDs and Tylenol are the only treatment that have provided any degree of pain relief, mild at best. Baclofen has no perceptible symptomatic benefits. However, use may decrease the frequency of calf, quad, hip flexor strains that I experience. Tizanidine is helpful for deeper sleep. However, the medication has not extended the total time that I remain asleep. As a result of worsening abdominal issues, I have discontinued all medications and supplements for 2 weeks. It is disappointing to express that no significant change in my physical symptoms has resulted from the discontinuation. Therefore, I may discontinue all of the medications permanently. And then we had a woman, Alyssa, from Marietta, Georgia, symptomatic woman with ALD, wrote, "The part I can't seem to handle is this pain. I've done just about all the pills, patches, and shots, but of course, none have worked. I'm not suicidal, but my pain is so bad, I don't really care if I wake up in the mornings anymore because I know what my body has to endure from the minute I wake up till I'm able to sleep. That is the scariest part of this disease for me and for my family." Charles, an adult cerebral ALD patient, writes, "I'm a longtime ALD patient. I was diagnosed in 2006. I was in a blind trial study shortly after being diagnosed and discovered I had the active ingredient. The trial was discontinued, which was so disappointing." And then finally, I have, well, again, not finally, but what I'll get to. I have Cynthia from Sarasota, Florida, a symptomatic woman with ALD. "I have trouble falling asleep because I get severe periodic leg spasms once in bed. Once I started taking pramipexole and Xanaflex, my restless legs calmed, but the spasms still came. I was suggested to try marijuana, which I did, and now I do need a puff or two at night to relax my leg spasms to be able to sleep."
Well, thank you to everyone who's been writing in, and yes, Kathleen, there's a lot to wade through, so thanks for pulling a few out to share right now. I want to come back to our Zoom panel here. Nikki and Ganesh, you talked a lot about some of the things that have been helpful. I'd like to check in on this kind of expanded discussion, maybe things that haven't been useful or have some downside. Is there anything you can share on this topic?
Well, I did mention that he has a baclofen pump, which involves surgery, and we have to go monthly to get it refilled. It's a distance, and it's hard to find closer people who can refill it every month, and it takes about 3 or 4 hours out of our day to go get it refilled. And it's actually more than once a month. It's actually more like every 3 weeks, because we want to get it before the alarm goes off.
Yeah.
And it's a lot. It takes, and we have to plan, because we have to have his day planned with his meals and his other medicines. So it's very challenging to do, because bathroom, feeding, and the meds and everything. So my husband has to take off work to take him, or I have to take him with another person, because we can't lift him and put him on the table. I can't do it by myself, so I need help.
Right.
So I have to make sure I have help with that. So that, it's challenging. He has trouble swallowing, and I give him about 35 pills a day, with all the supplements I give him, plus the prescription meds. And I have to give it to him with applesauce. And he has choked before, and it's happened. And luckily the person that was with me was able to get it out. But he does, sometimes we have to wash it down. So trouble swallowing with the pills.
Yeah.
He's had Botox. Again, that's scheduling and going to get that done. Not as difficult as baclofen pump. But those are some of the downsides of his treatment.
No, it's really helpful to hear that, just because we hear so much about, especially this morning, about all the different complications of just navigating daily life, and many of you have already reiterated this. So to then add in the complications of scheduling and planning around appointments, particularly for some of the certain treatments like baclofen that are more involved, and require lifting, and so more people involved. It's really, really important to understand that that's a critical element to getting care, is building it into otherwise a really complex day in life. Jamie, I'd like to come to you as well, kind of as the broader topic of maybe things that haven't been so helpful or come with some downside. Is anything in your experience that you'd like to share?
Yeah, from my experience with some of the treatments, I've had to modify my home to assist me with walking. I do require a walker to walk.
Yeah.
And however, even with the walker, I have fallen several times. One of those falls, I broke my ankle. And like I said, I don't have any feeling in either one of my feet or from the knee down on both legs. And thank goodness I have the neuropathy bad enough to where I can still feel my feet when I have pressure on them. If I have my feet up in the air and there's no pressure on them, no socks, I couldn't tell you where my feet are. I don't know where their location is. I don't take pain medication, because number one, I don't have any pain except for the neuropathy. And the pain there is, they said, I'm down to a 2-3 to 3-4 most of the time. So it's not that bad. There's been no other pretty much medication treatment. I do take a lot of supplements that assist with the neuropathy pain, or I feel they do. And I do take something to help me sleep at night, because my feet go into horrible spasms. It's not my legs itself, it's my feet. And they bend down just horribly. I can't get them back straight.
Yeah. Well, thank you, Jamie, for kind of building on what a little bit of what you shared before, but going, sharing more in terms of what your needs are, and just how, the things that are available just don't really address that. So I do appreciate it.
Yeah, like I said, I have fallen several times. One time I fell and hit my head, horrible concussion. 2 falls after that is when I fell and broke my ankle, and I'm still using the walker.
Yeah.
I don't know what now can help me around the house or even out and about to keep me straight up.
Right. Yeah. It's like this, adjustment or accommodation, I don't know, adaptation. I don't know what the right word is to say for what you're doing to, try to handle what you are experiencing now. But yes, totally appreciate that it's not helping the underlying symptom, and and maybe isn't even perfectly helping make that adaptation that you need. So.
Yeah, and the head injury really, I still have some issues with it. And for my broken ankle, I still have issues with that.
Yeah.
So because of the broken ankle and my weakness in my legs, I now have a total AFO brace with special shoes and everything for that darn right leg. Right.
Yeah. Well, thank you, Jamie, for sharing as well. I do want to make sure we get to a very important topic of talking about your goals and preferences for future treatments. I'll just check in with Kathleen before we get there. Any other comments that have come in on current treatments?
Sure. And first, I just wanted to give my 2 cents as a reminder that something that Janice mentioned earlier on the panel when we started this afternoon discussion was that although there are some ongoing trials or current trials, none of those are available to women. Mm-hmm. And so the best case scenario right now as a woman with ALD is to hope that we can get through a trial and that it works for the men with AMN, and that maybe we may be able to find someone willing to write it off script or off label for us later once it's approved. But because we're not included in any of this discussion right now, you'll note that it just doesn't come up in terms of any women with ALD. Just my soapbox moment. As far as downsides, I would just quickly say, because I know we want to get on to the next topic, there's an overwhelming number of comments of pros and cons, what works for one person and doesn't. And I'm just taken aback by how much time people have invested into these current treatments that, not to editorialize, but that people are just spending months and months titrating meds and then moving on to the next, kind of endlessly searching for something to give some relief, even if it lasts a little while, they're willing to try.
Sure. Well, thank you. And thank you for everyone who's been writing in and sharing those comments. We're going to now move to that final question, a really key one, as you all have been reflecting on your own experiences all day. First, what are those most troublesome symptoms and health effects from your ALD or your loved one's ALD? How do those, what do those most impact in your daily life? And what is even most worrying you for the future? Now this afternoon, you've already told us about, what are you using that is, helping a little bit or maybe not. I think the overwhelming message is, we saw even in the polling that there's some real gaps in need for more effective treatments. But we really want to know what your priorities are for those future treatments. And so to help us understand that, we're going to go to our final polling question of the day. This is going to get us a sense of what our audience here is thinking. And so if you can go to pollev.com/ALDPFDD. One last time, we're going to ask you, short of a complete cure, what top 3 specific things would you look for in an ideal treatment for ALD? And select the top 3. So as you're looking at this list, think about those things. If something could come down the pipeline, get approved and on the market as kind of the next drug, what is it that you would most be looking for or would be important for you in considering that drug? And so the options are A, help with sleep, B, an increased ability to walk, C, improvement in balance, D, control of incontinence, E, restored ability to be intimate with your partner, F, reduced spasticity, G, reduced pain, H, improvement in speech, I, slowing or halting the disease progression, J, prevention of cerebral ALD, or K, some other specific thing that you would be looking for in a next treatment for ALD that you would consider one of your top 3 things that's short of that cure. I know this probably is maybe the hardest question of the day, but so as you're thinking through these response options, think about what is driving those things that you're ticking off as your top treatment goals. What would be a meaningful, if we see, for example, the top response right now is the increased ability to walk. What would that look like for you? What would that mean for you in your daily life? Slowing or halting disease progression. What is it that's worrying you about your disease progression? And again, if something could slow or halt disease, what would that mean for you in your life? We see similarly close after slowing and halting disease progression, improvement in balance. Again, what is your measure of success? What would help you if your balance was improved? How much improvement would you need to see? We see kind of as number 4, prevention of cerebral ALD. We've heard a little bit about this already, but we know that this is really important, so I want to continue to hear about it as well as helping control incontinence. One of the things that is always so striking to me is that each and every one of these different options is in somebody's top 3 of what they're looking for in an ideal treatment for their ALD. So we know that all of these things are experienced, but not just that they're experienced, but they're also important to you, and you're looking for help with these things. So to discuss this topic, we want to encourage you to call in. You can join us and speak to your thoughts about what you're looking for from a future treatment by calling at 1-703-844-3231. Again, this will be the last opportunity we have today for you to have your voice heard. So you can call in at 1-703-844-3231. Or, of course, you can write in that comment box. So many of you have been writing in today. You can continue to do so there as well. But I want to visit our panel here and maybe start with Tim on this one. As you're thinking about future treatments and what would represent an important, meaningful, or even ideal next treatment that's short of a cure, what would that be for you?
Sure. Well, for me, of course, the highest priorities is probably reduced pain, prevention of disease progression, and then, of course, prevention of cerebral ALD, which I think many of us fear the most.
Yeah.
What I do want to say, though, is that I am in the Min 102 trial. I've also, I don't know if anybody remembers, there was a MD 1003 clinical trial a while back, which was basically 300 milligrams of biotin that you can take a day. And I wasn't able to participate in that trial, but I got on Amazon and I ordered a bunch of biotin, and I didn't want to miss out on an opportunity if that helped people in some way. I didn't want to, miss out on that. So I took it myself, and I'm willing to sacrifice my body, myself, as to help our community, to help prevent anyone else from having to go through and deal with what we have to. And so I want everybody to know that we want to prevent people in the future from having to deal with what we do. And so,
yes.
Yeah.
Yeah. Well, thank you so much, Tim. Thank you for reflecting. I know it's I do think this is probably the hardest question of the day, is to look forward, and talk about what you'd be willing to tolerate. And, but I do think we heard you loud and clear there. I'd like to bring Ben in.
Can I say
of course.
One more thing real quick? I don't know if you're going to get back to me or not, but
sure.
Real quick, about 4 or 5 years ago, my wife went to a motivational speaker, and she had them do an exercise where they had to write down, 10 dreams that they have, and you write them down every morning, but you write them down in the past tense, like you've already accomplished them.
Yeah.
And of course, my wife wanted me to start doing that. So every day for the last 4 or 5 years, I write down that I helped come up with a cure for AMN. And we have a lot of great people in this community. We have a lot of great pharmaceutical partners that are putting in the work and coming up with some great new ideas. And I just, with all of our friends and hopefully a little help from our friends from the FDA, that I think in the near future, we can cross that one off the list. And that's just one of my dreams and one of my goals that I want to accomplish.
Yes.
With everyone.
Well, thank you for sharing that, and we hope that it's not just a dream, but a reality along with you, Tim. So thank you. Ben, how I want to come to you next on this topic. What would be a top treatment goal or a couple of goals that you have?
Yeah, so I think basically stopping the progression of the disease, reversing some or all of the symptoms, these endpoints we've talked about. And I think more broadly speaking, looking at our identity as men, as human beings, and trying to regain our energy, our autonomy, our mobility, and particularly as we're in the house, but we're all emerging from COVID or trying to get out and do some travel. And it would be wonderful to do it with the energy and safety and autonomy that we dream of.
Sure.
And I would add also the dimension of employment, career, and income, which for men and women is, of course, essential.
Absolutely. Well, thank you, Ben. Again, hear you loud and clear. I want to check our other Zoom panelists. Wave of a hand if you would like to add to this topic. Yeah, Emma.
Yeah, so like Ben and Tim mentioned, I think that there are a lot of things that we would look for in a potential treatment. I know in my family, we say in a perfect world, it would be for my mom to regain the ability to walk again. But unfortunately, that probably won't happen during her lifetime. That's why we do things like this, to try to educate people and get things started for the future. But I would say more reasonable goals in terms of treatments would be to halt disease progression. For her disease progression was pretty quick. So we just don't want to see that go downhill anymore. She had to miss out on a lot of stuff, and I don't want her to miss out on anything else, especially as me and my sister start to get a little bit older too. I would say incontinence is another big thing to be managed a little bit better. So there's not that constant anxiety in your daily life of having to plan out your day because of your incontinence issues.
Absolutely. Jamie?
Yeah, for me on this, I would love to be able to halt the disease progression. Mine for the last 3 years has come on so strong and so fast. My biggest fear is waking up in the morning and I can't walk.
Yeah.
So that's my fear. I would love to not be in any pain, but like I said, I need the pain so that I know where my feet are. But we can do anything just to slow or stop the progression would be wonderful. If I could stay right where I am, I could do it. Any worse than what I am now, I'm going to need help every day.
Right. Thank you, Jamie. And Nikki and Ganesh.
Hold on. So Ganesh. And yeah, he wants to, he feels exactly the way Ben, Tim, Jamie, and Emma, everything. One, stop progression is the biggest thing.
Yeah.
And I've said before, when he was progressing, if we can stop it now, then that would just be huge, and he could still have quality of life and everything would be great. Number one, stop progression. What gun? And if we can regain anything, and he would be willing to try anything, like what Tim said with the biotin. I put him on biotin too. I heard about vitamin D helping. I put him on vitamin D, resveratrol, metformin, like all these things that I heard are helpful. I went out and got it and put him, because I don't want him to miss out. And the problem is he doesn't qualify because he has cerebral ALD.
Yeah.
He doesn't qualify for all of these things, or he's over 18 or, whatever. So there's nothing for him. He said a million times he's willing to be a guinea pig.
Yeah.
He wants to help people. And so no one else has to go, he wants to be helpful too. So,
yeah. Well, thank you, Ganesh. And thank you, Nikki, for sharing that. So important, that, willingness to take on, the uncertainty of knowing whether something will help or hurt, just to help, advance treatments for this community. I'm hearing that from across the board from you all here, so I really appreciate it. I do want to thank all of you on our Zoom panel for contributing throughout this session. I do want to go to some phone callers, but before moving on, I just did want to really say thank you. You've added so much to this discussion. So now I do want to go to the phone line. I see we have Mary from Houston, Texas, who's a caregiver and wants to share a bit about what she would like to see from future treatments. So Mary, I'd like to welcome you. Are you with us?
Yes.
Great.
Can you hear me?
Yes, we can hear you. So very interested to hear from your perspective as a caregiver of what you would like to see for your son.
Hi, so my name is Mary McCormick. I am 34 years old. I live in Houston, Texas. My husband was diagnosed with ALD after our first year of marriage. We've been married for 6 years now.
Mm-hmm.
And after that, his entire family was diagnosed as well. My sister-in-law, brother-in-law, my niece, and my nephew as well. My mother-in-law has also been diagnosed as well, too. So what I would like to see as part of a clinical trial, kind of the three main ones that really especially hit our family.
Yes.
That's what I needed to answer, right?
Yes, no, that's exactly right.
Okay. Is the prevention of ALD, the increased walking, and reduced pain.
Yes. Well, can you tell us a little bit, maybe, I think we probably better understand, preventing cerebral ALD, but what would, maybe helping with walking look like, how what would you need to see that would make things like activities in daily life be a little bit easier?
Oh, that's right. Okay, sorry about that.
No.
So increased walking, it would really help Patrick. We're young, and it's really hard to see his ankles get extremely painful. His legs get very stiff. Any amount of extreme heat or cold tends to make his legs buckle.
Yes.
For instance, we were at a friend's house on July 4th, and he touched the patio, and his leg just buckled, and he fell. And after that happens, the spasms go up his leg for hours, and he's just in excruciating pain. And then he can't get out of bed. He can't do anything else. He can't move.
Yeah.
And it's just really hard to see and to watch that. He loved riding his bike, and he loves being active, and he really can't do that anymore. I've had to really step up and help with doing things around the house. I'm the one that has to move furniture if we ever have to move anything, get on ladders and change AC vents. When we go to the airport, I'm the one in charge of all the luggage and the bags. A lot of stuff that, even taking out the trash in the morning. Sometimes I'm late to work, but I have to take it out. I don't have anyone else that can help me, because if he does, then he might fall, and we can't afford for him to fall.
Right.
Another thing that's really impacted our life is we really want kids, and we feel that he's he'll be unable to, sorry, this is really hard topic.
It's okay.
He won't be able to take kids, and so it'll be hard for us. because, you know, it'll just be me. And I know that there are a lot of single parents out there. But, you know, just being able to, you know, chase after kids, even walk our dogs, like simple stuff that people are able to do and he can't do.
Right.
It's just really, really hard.
Yeah. Well, Mary, thank you so much for calling and sharing this. I know it's hard to share too, you know, but, you know, I think we really understand, you know, what, you know, both, you know, Patrick, you know, would be helpful for him to make him better, but also, you know, to be able to not have things get worse in the future. So thank you so much for helping us and putting that into perspective. I want to bring in Eric here, who we also have on the phones from Pennsylvania, you know, who's living with AMN, wants to share some of his perspectives about his goals for a future treatment. Eric, are you with us?
Yes, sir. Good afternoon, everyone.
Welcome.
Yeah, I've been listening to everybody in and out here. So some of the top three, I definitely agree with a lot of people. You can really feel, you can really feel it in the calls.
Yes.
How this disease really has affected not just us with AMN or ALD, but the domino effect. Our caregivers, our family, our friends. So, you know, short of a cure, you know, you know, slow or stop progression, just like everybody else said. I would agree with that.
Yeah.
Remyelination is what we need also. I think if we slow or stop, we're going to be able to gain that back, some remyelination. And some of the other things that I really would need help with is, you know, the quality of life things, like the incontinence, the sexual dysfunction stuff, that I think are, you know, give some dignity back to us with ALD and AMN. I think that would be, you know, a starting point for us. But I can tell everybody on the call agrees that slow or stop progression where we're at would be, you know, outstanding. So thanks for everybody that has called in. It's been a great day to listen to this.
Yeah. Well, thank you, Eric, for all of your contributions and calling in as well. So we have one last caller. This is such an important topic. I know we're going a few minutes over our planned time for this, but I want to get Alan from Massachusetts, also with AMN, wants to share some of his hopes for future treatment. So Alan, are you with us?
Yeah, can you hear me?
We can, yes.
Yeah. Well, like mine is pretty much similar to everyone. It's just quality of life. Definitely for like treatment, I would love it if it could help my walking gait.
Yes.
I really miss a lot of things that I used to do. I used to play basketball. I used to run when I was younger, and I had this disease, and just some way to regain that would be nice. And also the incontinence, because I do take the Botox injections. I've done that already like 2 or 3 times already.
Mm-hmm.
And it seems not like it works, but it doesn't work really good. And it's like always trying to find the right amount of dosage for the Botox injection. It's just, it's hard to find out like what really works. And so those two things would be the ones that I would put high up on my list, especially since, like I already spoke in the panel, that I like to do things with my nephews and stuff, and I'm not able to do it because of my inability or my disability that has grown worse in my walking and my incontinence over time.
Yes. Well, Alan, you know, thank you so much for sharing that, and you know, absolutely, you know, I'm hearing you on how some help with some of these symptoms, walking, incontinence, would be so valuable for you, and you know, especially as an uncle. So thank you for sharing that. Unfortunately, I don't think we will have time to get to any additional callers, but I do want to thank everyone who has been calling in today. I will do want to at least give voice to some of those written comments that we've gotten. So I want to check in with Kathleen on what we're hearing for treatment goals for the future.
Sure, absolutely. And again, thank you so much for everyone who has written in today. It breaks my heart that we cannot give actual voice to all of these comments, but I'm so grateful again for all the different stories and input. Patty from Pacific Palisades, California, a friend of mine with a symptomatic woman with ALD. She writes, short of a complete cure, our mission should be to stop the progression of the disease in men, women, and children. Ted, a man with AMN, writes, remyelination. I would like my body to return close to normal function, even if it were only for 10 years or so. Kathy, a mother of an AMN patient from Woburn, Massachusetts, says, my son Jason will soon be 42 years old. His message is, I want to be able to walk. And Amy, a symptomatic woman with ALD from Maryland, writes, please find a way to safely prevent or reverse symptom presentation and progression in females. I know it is likely too late for me, but I am heartbroken to think my daughter or hypothetical grandchildren and so many others may suffer. The guilt is gut-wrenching.
Yeah. Well, thank you. Thank you, Kathleen, for sharing those and everyone who's contributed. And please know that all of the feedback we've received today, even if we weren't able to read it out loud, we have it. We will be incorporating it into the Voice of the Patient report. That will be the living summary. And as Dr. Wilson Bryan from FDA talked about, that will be a reference for the review teams at FDA moving forward. But this concludes the part of our meeting where we're getting your input. It's been an incredible day. We spent the morning learning about what it is to live with ALD, and we spent the afternoon really getting your assessment of current treatment approaches and ultimately what you're looking for from future treatments. I can't help but say, as the meeting moderator, you all were incredible. All of you that were on panels, were on Zoom, called in and wrote in. We asked a lot of you to pull back the curtain of what it is to live with ALD and really make it real and not sugarcoat it for us. And you did that. And I know it's not easy to do that. And, we really got to learn just, how incredible this community is given everything that they deal with and yet how much you persevere. That was, kind of the unstated message of all of this is, you keep fighting back. You're willing to participate in trials and try new things, not just for yourselves, but for each other and your community. And, it's just been a really incredible and powerful day. And you've all made my job really easy as the moderator because you really stepped up and shared so much. So, kind of before I sign off, I just wanted to say thank you. So now I get to have the pleasure of introducing my friend and colleague, Larry Bauer, who's going to be providing summary remarks in a truly impossible task after a full day like today. But Larry will be sharing some of the key themes of what he's heard. Larry is the perfect person to do this. Larry has a background as a clinical research nurse. He worked at NIH for 17 years. Went to FDA and co-founded the Rare Diseases Program within the Center for Drug Evaluation and Research. So he was dedicated to helping find ways to develop and ultimately approve drugs for rare diseases. And he's been a critical team member in helping plan this meeting. So without further ado, Larry, take it away.
Thank you so much, James. It's been an incredible day listening to all of you and to all of your stories. And I will, as James said, I'm going to try to summarize it. It will be a very high-level summary. And just remember, as James said, that the following Voice of the Patient report that will be coming after this meeting will be a very detailed account of the meeting. So today we started off, the meeting was opened by Kathleen O'Sullivan-Fortin, our co-moderator, who's the co-founder and board member of ALD Connect, and she's also a mom of a son with ALD and also a person living with ALD. Kathleen was followed by a presentation from Dr. Wilson Bryan from the FDA, who's a part of the Office of Tissues and Advanced Therapies in CBER. Dr. Bryan shared that PFDD meetings are valuable to the FDA to learn from the experts, people living with X-linked ALD and their care partners, to help facilitate treatment development, to design clinical trials and review new drugs for ALD. A clinical overview was presented by Dr. Florian Eichler, who is an associate professor of neurology at Harvard Medical School. A few key points from his overview is that okay, ALD is a rare disease. It's caused by a single gene mutation in the ABCD1 gene that results in the accumulation of very long-chain fatty acids. There's a newborn screening test for ALD, and there are about 5 phenotypes with distinct pathophysiologies. And ALD in the US affects about 10,000 children, adult women, and men. It leads to inflammatory deterioration of the myelin sheath in nerves in the brain and the spinal cord. It's a chronic progressive disease with AMN leads to a host of peripheral nerve issues, and cerebral ALD leads to cognitive decline and seizures. The treatments available are symptomatic, but they don't halt progression, and new treatments are in development. And this ELPFDD meeting focused on adults with ALD, AMN, and cerebral ALD. So we started out the morning talking about health effects, symptoms, and impacts. We heard from Mary, who has difficulty walking, balance problems, pain, falls, and spasms. Doctors initially thought she had MS. Her symptoms have been life-changing, constantly struggling with balance and severely affecting her level of activity. She also has bowel and bladder issues. We heard from Alan, who has AMN, and first presented with seizures. He started progressing in his 30s with gait slowness and instability. He walks now with crutches and braces and cannot drive. He worries about bowel and bladder issues and has to plan when he goes out. He's concerned also about falling when no one is around and his inability to get up from the ground. Barbara, then we heard from, who has symptoms that started at age 22, with first experiencing pins and needles, balance problems, and gait problems. She's had cuts and bruises from lack of sensation in her extremities. A wheelchair eventually became necessary. Her speech is halting and quiet, and swallowing is affected. She worries about what skill she's going to lose next. And then we heard from Eric, who's 43 with AMN, has had symptoms for the last 15 years. He developed spasticity and coordination problems. Spasticity feels like tightness in the muscles and spasms. He lost his career and needed genetics counseling before having kids. He's had frequent falls, has a neurogenic bladder, sexual dysfunction, uses a wheelchair, and this affects every aspect of his life. And finally, in the morning, we heard from Lori, who lost her husband, Mark, to cerebral ALD at age 44. Once ALD hit his brain, Mark died within 8 months. Prior to brain involvement, he had severe gait issues. As his brain failed, Mark lost the ability to speak. He needed help with feeding to avoid aspiration and developed recurrent urinary tract infections. He lost his memory and eventually did not even recognize his wife. He gradually withdrew from life until he died. So we heard that balance, gait, incontinence, all these things, they seem to have the greatest impacts on people's lives with ALD. And the devastation from cerebral ALD robs people of their minds and the ability to care for themselves. We also heard that progression is rapid from onset of cerebral ALD to death. And a great concern for the future for everyone is disease progression. We came back in the afternoon after lunch to shift gears a little bit, talking about ALD treatments. We heard from Janice, who lost her 8-year-old son after only 6 months of disease onset. His diagnosis led to 3 other family members being diagnosed. She takes Lyrica for nerve pain and CBD for insomnia. She talked about the paucity of clinical trials that include women and said that women with ALD feel invisible. Ken was diagnosed at age 31. He uses leg braces for the past 4 years, as well as a walking stick. Mybetriq has provided some relief for the urinary urgency he experiences. He lost his 39-year-old brother to cerebral ALD. He's frustrated that there are not good treatments for cerebral ALD, and he wants treatments that will prevent progression to cerebral ALD. We heard from Julie, who also has a brother with ALD. She uses a walking stick to help her, and it's also there to be a visual clue to other people that she has gait issues. She's had cortisone injections for back pain, but it was not that successful. She uses baclofen, does workouts, healthy diet, and has had poor results with Ampero, which is sometimes used in MS patients. We heard from Harry. He and his older brother both have AMN. He had bladder neck incision surgery to try to help with urine flow. He also uses pelvic floor exercises, has used PT, daily exercising, deep massage, which prevents some temporary relief. He also takes magnesium, which helps with cramps, especially after physical activity. And finally, in the afternoon, we heard from the D'Agostino family, who sadly lost both of their sons to ALD. Their younger son, Jason, died at age 22, and their other son, Justin, tried stem cell treatments and hyperbaric treatments in Mexico, but continued to progress. He eventually had a fall that required several operations, but led to his continued decline. And after losing his motor skills, difficulty swallowing, and difficulty breathing, Justin died at age 37. The boy's mom, Cheryl, is also affected and becoming symptomatic. The family statement was ALD, the destroyer of life and families. So we've heard about the tremendous unmet medical need in the ALD community. Each of the major symptoms, including gait disturbance, bowel and bladder issues, cognitive decline, and speech issues, have incredible quality of life impacts. The treatments people try are mostly palliative, and there are no FDA-approved treatments for ALD at this time. Treatments can be helpful, but most do not really treat the underlying cause or stop progression of ALD. Research and development in this area is desperately needed. And now, to close the meeting, back to Kathleen in the studio.
Thank you for that summary, Larry. I don't know how you did it. There's so much we've talked about. This has been an incredible day of hearing personal insights to help us all better understand ALD and its impact. Thank you to the FDA for giving us permission to hold this meeting, and to the FDA's staff who tuned in today. Special thanks to Shannon Cole and Karen Jackler from the FDA, who guided us through this process. Thank you to Dr. Wilson Bryan from the FDA for your perspective on the importance of externally led patient-focused drug development meetings, and to Dr. Florian Eichler for the very interesting and thorough clinical overview of ALD in all its adult manifestations. We appreciate James Valentine, Larry Bauer, and the entire team from Dudley Digital Works for all of their work to produce this meeting. We could not have done this without the leadership of Kelly Miettinen and the rest of the ALD Connect team, especially Felicity Emerson, Emma Hayes, Georgia McLean, and Christy Higuera, who worked so hard to plan this meeting. A special thanks to our supporters and partner organizations. This meeting would not have happened without you. Thank you to our sponsors, Audubon, Minarex, and Swan Bio, who helped support this opportunity to allow patients to rewrite the reference book on AMN and ALD from our shared experiences. But a huge thanks goes to you, my fellow community of men and women with AMN and ALD and cerebral ALD, and our caregivers. Thank you for agreeing to bravely and honestly lay bare the worst that this disease has to offer. The embarrassing stories, the sad stories, the frightening stories, all part of our lives. Thank you for sharing your experiences. And to those of you who stepped forward to be part of a video panel or to speak on Zoom or to call in or write in to share your insights, this meeting could not have been as impactful or enlightening without each and every one of you. In the coming months, we'll compile all of the information from today into a Voice of the Patient report, which will be available on the ALD Connect website. Today's program will be available on demand immediately after we conclude at the same link you are at now. The form to submit comments for the report is open for another 30 days, so please consider submitting additional comments, which will be added to the Voice of the Patient report. The video, transcript, and report, along with the list of supporters and partner organizations, is publicly available to anyone once it's published and posted on our website, www.aldconnect.org. There will also be a link from the FDA website. Thank you to everyone. The impact of this meeting will be felt for years to come.